Thank you. Good morning, everyone, and welcome to the Human Services Joint Subcommittee meeting. And this meeting will now come to order. Committee Secretary, would you please call the roll?
Senator Cannizzaro.
Here.
Senator Dondero Loop.
Here.
Senator Hammond. Senator Kiekefer.
Here.
Senator Ratty.
Here.
Assemblywoman Benitez Thompson.
Here.
Assemblywoman Carlton.
Here.
Assemblyman Frierson.
Here.
Assemblyman Roberts.
Here.
Assemblywoman Titus.
Here.
Assemblywoman Tolles.
Here.
Assemblyman Watts.
Here.
And Chair Monroe Moreno.
And I am here. Will you please mark members who aren't present at this time present when they arrive?
Of course.
I'd like to welcome everyone to today's meeting. We will be hearing 5 Department of Health and Human Services, Division of Welfare and Support Services budgets today. Before we begin today's meeting, I would briefly like to review how our virtual meetings work. The legislative building remains closed to the public, and so all committee meetings will be held virtually. Committee members, staff, and everyone else will be participating either through Zoom or by telephone. For committee members, if you could please remember to silence your phones during the meeting and mute your microphones while you are not speaking. It helps to minimize background noise. Please leave your cameras on so that we can maintain a quorum throughout our meeting today. And if you wish to ask a question, please just send me an instant message. Members of the public who wish to testify or present public comment will have the option to call in or to submit written testimony or comments. This can be done online at the page for today's meeting on Nellis, which is located on the legislature's website, in the same place that you will find today's agenda. Members of the public, if you have the option to submit your opinions on anything you hear today online and sign up to participate in the public comment period, which will be at the end of today's meeting. So with that, we'll move on to the first item on our agenda. The first budget for the day will be HHS Welfare, which is 101-2328, and I invite Administrator Steve Fisher and his staff to present today's budget. Welcome to the committee, and you can start anytime you're ready.
Good morning, Madam Chair. For the record, Steve Fisher. I serve as the Administrator for the Division of Welfare and Supportive Services, and good morning, and thank you for the opportunity to present our budget this morning. I have with me in the room, to my left, Joe Garcia. He's the Acting Deputy Administrator for Field Operations Support. Directly in the middle behind me, I have Crystal Askew. She is the Chief over our Child Care Program. And then behind her, I have Bart London. He's our Chief IT Manager. And also joining us on Zoom, I have Robert Thompson. He's the Deputy Administrator over Field Operations. And I also have Brenda Berry, our Chief Financial Officer. And this morning, Madam Chair, our plan is to provide the committee with a brief overview of our organization and how we do things here at the division, and then briefly step through our caseload, and then jump right into our 3228 budget. Does that sound good to you, Madam Chair?
That sounds good. And as you go through the budgets, at the end of each budget, we'll stop for questions from the committee members.
Great. Okay, we'll go ahead and start the presentation.
And Mr. Fisher, you're just a little low. If there's any way you can get closer to the mic or just speak a little bit louder. It's a little hard for me to hear. I'm not sure about the other members.
Is this better?
Yes, that's a little better. Thank you.
Okay. Okay, next slide, please. So the overall mission of the Division of Welfare and Supportive Services is really to provide public assistance to all who qualify and reasonable support for children with absentee parents. Next slide, please. This is a breakout of our organization, and I'll just spend a brief amount of time here just kind of describing what we do here at the Division of Welfare. We determine eligibility for 5 public assistance programs: temporary assistance for needy families, otherwise known as TANF, Medicaid, Supplemental Nutrition Assistance Program, or SNAP, energy assistance, and the Child Care Program. We also administer the Child Support Enforcement Program. Our Child Support Enforcement Program operates through a combination of 9 participating district attorneys' offices and 3 state program area offices. To access our public assistance services, customers can click in, they can call in, they can mail in, they can come into one of our 19 welfare offices throughout the state. The most efficient way, though, is to apply online through Access Nevada. Customers can apply verbally over the phone, and that's been working well during this pandemic time. We can receive applications via mail or through drop boxes, for example, and really the final method is in person. They can come into one of our 19 offices. In addition to the 19 offices, we do have an outreach team of 35 case managers who visit 129 different locations, providing the same services. And on average, they visit 64 special events each year. So it really doesn't matter how the work comes into our agency. Our new business model and the workload management system provides us with the flexibility to manage the work across the entire agency. For example, a worker in Elko can process an application for a customer who lives in Las Vegas, so it doesn't really matter location. Our goal is one and done, and we do everything we possibly can to complete a task at first touch. Certainly over the last 11 months, it has been a challenge for both our staff and our customers. I do want to thank our staff, though, for all their hard work and dedication, and also I'd like to thank the legislature for your support over the years. Without our staff and your support, we certainly would not have been able to continue providing our services to low-income Nevadans during this pandemic. Combination of our new business model and technology that supports it provides us with the flexibility to shift our resources quickly to ensure our customers continue to receive the services they need. Just an update, we have 200 staff that are helping over at the Department of Employment, Training and Rehabilitation. They're over there through the end of March. They've processed over 112,000 UI claims, helping the citizens of Nevada get their UI benefits. So kudos to them as well. I want to thank Joe Garcia for his leadership on that particular project. Thank you, Joe. With that, next slide, please. Now we're going to step into our caseload projections. Certainly, caseload drives our business. And as we look back over the past 11 months, there have been and continue to be many variables such as waivers, pandemic programs that we've had to stand up and take down, and additional UI benefits that have not only impacted our caseloads, but also the number of clients and actions that we need to take and that our staff need to process. To project these caseloads, the department's data analytics team does an amazing job of taking into account historical data, economic trends, and anticipated policy changes that we might be making. They project the number of recipients entering the program each month, as well as the probability of those leaving the program to come up with the overall caseload forecast that we'll be stepping through. If you would like more information about how the demographics of our SNAP, TANF, Medicaid program are broken out statewide, or for the district that you represent, we provided a link on the very last page of our presentation to the 2021 Health Profiles Dashboard. It's amazing. I would recommend you go there. It was created by the department's analytics team. It's fantastic. As far as the temporary assistance for needy families projections go, we are projecting that the TANF caseload will decrease approximately 6% from our base year, state fiscal year 20 through 2023. Next slide, please. These are our Medicaid projections. From a Medicaid perspective, this caseload is projected to increase 17, almost 18% in the biennium from our state fiscal year 20 base year through state fiscal year 23. Next slide, please. These are our supplemental nutrition assistance program projections. As you can see from the slide, the caseload is projected to increase about 7.26% over the biennium. Next slide, please. Our energy assistance program is projected to increase about 26% over the biennium. Next slide, please. And our child care program is really expected to stay pretty stable, about 1% increase over the biennium from the base year. Next slide, please. This is just a representation of a pie chart, comparing this biennium to the governor's recommended budget. We are requesting a 12.5% increase overall, an 8.5% increase in general fund. Next slide, please. It's just a representation broken out by our different budget accounts. Next slide, please. And now we are getting into the first budget account, the Welfare Administration budget, which funds the administrative expenses associated with ensuring public assistance and the child support enforcement programs are administered in accordance with federal and state regulations. So our first, next slide, please. Our first enhancement is our E-250 enhancement. So we at the division are required by federal regulations within our federal programs, the ones that I've just covered, to send notifications out to our customers whenever their eligibility changes. We need to notify you what that change is. We use the SmartCom software as our correspondence management solution. So it's the software that actually generates those notices that are mailed out to our customers. And so as the caseloads increase, as the number of mailings increase, this is a tiered software licensing agreement. So as you increase in tiers, the cost of the licensing goes up. Therefore, we're making this request for additional licensing. Moving on to E-275, this is a request for a state position, social services program specialist. We're requesting this position to replace a current contract position. We've had a contract position in place for quite some time. So this request, the job duties do not change. Everything is exactly the same. What we're doing is essentially converting a contract position to a state position in this particular decision unit for our SNAP outreach program. Moving on to the next decision unit, this is our E-276. This request is requesting a social services program specialist for our TANF program. The TANF program is a block grant. It's approximately $43.8 million in block grant dollars. In order for the state to draw down or receive those $43.8 million, there's a $27 million match, or they call it maintenance of effort dollars that the state needs to expend on the TANF program. Any state dollars that are spent over and above that $27 million in maintenance of effort are considered excess maintenance of effort dollars. Excess MOE is used to calculate a caseload reduction credit, and that caseload reduction credit can be applied to the state's work participation rate. So this position will be responsible, first and foremost, for identifying any state maintenance of effort dollars that are being expended. Secondly, this position will be responsible for tracking, collecting those dollars, and most importantly, making sure we report those dollars to our federal programs. This historically hasn't been the case over the years, and this is probably a good opportunity for me just to update the committee on our work participation rate and the penalties. There are two work participation rates that the division needs to meet. The first one is called a two-parent work participation rate, and that percent is 90%. The second one is called the all-family work participation rate, and that percentage is 50% that the division needs to meet. As I've discussed before, the division has been penalized just over $20 million due to failure to meet the two-parent work participation rate going all the way back to 2007, and failure to meet the all-family work participation rate in 2007 and also in 2012 through 17. The division has successfully met the all-family work participation rate in 2018. And then at that point, we entered into what's called a corrective compliance for 2019 in an attempt to reset the penalties that we were penalized for from years 2012 through 2017. So the all-family work participation rate was met in 2019 with what I'm going to call is a raw work participation rate of 38.1%. But then we were able to combine with that the caseload reduction credit because of the excess maintenance of effort dollars that we received during 2019, which equaled a caseload reduction credit of 22%. So if you add the 22% to the 38%, we actually achieved an unprecedented overall all-family rate of 60%. So we met the all-family work participation rate in 2019. While DWSS has not met the two-parent work participation rate goals, the majority of the penalty is due to the all-family. The division is pending a notification from ACF regarding the corrective compliance plan, but we expect the outcome to be very favorable, waiving an estimated $18.5 million of those total penalties. So this is an important and critical position for us to manage those maintenance of effort dollars so we can continue to stay out of the penalty status going forward. And we can focus our attention on more important things like, focusing on moving families off of our public assistance programs through things like work activities. Also, we just recently started discussions with, and we're working with Clark County and Washoe County, and we reinstated TANF funding for their emergency assistance program. Both Washoe County and Clark County contribute a substantial amount of maintenance of effort dollars to the TANF program because they expend some dollars on their child welfare programs that meet the purposes of TANF, so we're able to utilize that for our maintenance of effort. So we look forward to continuing to fund their emergency assistance program going forward. Next slide, please. Our enhancement 278 inventory. So our current inventory tracking system is very antiquated. It's manual. Essentially, folks have to go around and write down, we have these barcodes on these machines, but they have to physically write down what the number is, versus we're looking for a new, efficient inventory tracking system where we can scan those barcodes, we can automate that process, and certainly increase productivity and obviously the quality as well. So that's what this decision unit is. Our enhancement 552 is a request this is a technology investment request to automate the Medicaid waiver eligibility process. The home and community-based services waiver provides Medicaid funding for home and community-based services to individuals who otherwise would meet the eligibility requirements for Medicaid-funded institutional care. Nevada has 3 home and community-based service waivers that serve vulnerable populations, including the frail, elderly, the physically disabled, and individuals with intellectual disabilities and related conditions. These services are intended to provide additional supports above the normal services provided by Medicaid to keep people in their community and limit the amount of admissions to long-term care settings. The current process for evaluating and determining eligibility for waiver services is a manual and time-consuming process. It requires physical documentation, written approval by multiple DHHS divisions using things like interoffice mail and email to transfer this information back and forth. The time staff spend forwarding information between the three agencies causes delays in case processing and the customer access to care. In some instances, applications are denied and then either reinstated or reevaluated, or the customer must complete a new application. Lack of automation and access to available information results in lost productivity. Case managers from the three different agencies spend a lot of time pushing paper through the process rather than making case management decisions and serving their customers. This project too was submitted to the State IT Strategic Planning Committee, who ranked it #1 out of, I think, the overall 16 projects that they ranked. This project is also eligible for Medicaid 90/10 funding. E683. This request holds 12 vacant positions open in fiscal year 2022 and then reinstates those positions in fiscal year 2023. We do have 6 quality control specialist positions, and would also include 3 IT positions, 1 in personnel and 1 social services program specialist. The 6 positions, the 6 quality control specialists do have, I think 5 of them do have, are filled currently. However, when we took a look across the agency, when we were doing our 12% budget cuts, we were looking for positions where if this were to occur, these people would have a place to go, a position to move over to, and certainly not lose any pay or anything and just continue working here at the Division of Welfare and Supportive Services. So those 5 individuals will have a place to land within the Division of Welfare and Supportive Services. Next slide, please. And the E506 and the E906 go together. This request is transferring 3 positions from the Division of Welfare. Division of Welfare's budget 3228 over to the Director's Office's data standardization. And so that's what these 2 enhancement requests are for. And with that, Madam Chair, that ends the 3228 welfare administrative budget. And at this time, we'll certainly answer any questions you might have.
Thank you, Administrator Fisher. I know we have a few questions, and we will start our questioning today with Senator Dondero Loop.
Thank you, Madam Chair. And if you'll indulge me, I have a couple questions. So would this new social services contract specialist position replace the existing contract staff? And if so, I'm sorry, I thought I decided to add the second part there. So if so, is that expenditure an offset included in this enhancement to eliminate the expenditures for contract staff?
So the answer to your first question is yes, the contract position will go away. However, we will give certainly preferential treatment to that particular individual to hire her as a state, into the state position. However, yes, it's a 100% federally funded. I don't know for sure if it completely offsets. I know when we contract with contract staff, we try to keep the salaries the same with regards to state versus contract, but I'm not sure if you add in all the additional benefits and so on, the cost of it's an even split. I don't know the answer to that question. Perhaps Brenda Berry, our Chief Financial Officer, might be able to answer that question. Brenda, are you muted? Are you on?
Good morning, this is Brenda Berry. I'm the Chief Financial Officer for the Division of Welfare and Supportive Services. And I believe what you're trying to, or what you're asking is if we reduced that decision unit by the contract staff member. Is that what you're asking?
Yes.
And the answer is no. We did leave the contract staff in there for potential of a possible need in the future for a contract staff member. There's various things this program has to do that may require them to, at some point in the future, hire another contract.
Okay, thank you very much. Follow up, Madam Chair. What specific changes to federal rules or regulations have occurred that have increased the division workload?
Oh boy, where do I start? I know there have been some changes to the SNAP program. Certainly food insecurity is an issue with regards to our senior population being isolated. Certainly our kids not going to school and getting their breakfast meal or their lunch meal. So the Food Nutrition Services has a couple of programs that they stood up. One is called the Pandemic EBT program, which provides additional staff benefits to those children who are eligible for the food reduced lunch program. And so that was one program we stood up, which certainly created a number of additional tasks that our staff have to work as part of delivering those benefits out to the community. Another program that was stood up from FNS was I call it an emergency, it's the emergency SNAP benefits. And basically that was adding your SNAP benefits up to the maximum allotment amount. And so that was just another program that we stood up, and also created additional workload for our staff to process those cases. And then just recently, they just passed an act, and they are increasing the SNAP benefits by 15% between January and June. And anytime we go out and increase benefits, that creates additional workload for our staff. That's in the SNAP program. Let's see, in the Medicaid program, in order for the state of Nevada to receive the additional FMAP increase, the state had to agree to not remove anyone from the Medicaid program, with the exception of, I think there's 3 reasons: if they voluntarily withdraw, if they move out of state, notifies they moved out of state, and of course, if they pass away, they would be removed from the program. But we're not allowed to remove anyone from the program. So what that does, though, is every year we have what's called redetermination. So every 12 months, we have to do a redetermination on Medicaid cases. Well, anytime you send out, and the system automatically sends these redeterminations out to everyone. And so when we receive them back, if we do receive some back, what we do is we process those, and we are able to move those individuals out 12 months. However, the redeterminations that we do not receive, we can only push those out 6 months per the CMS regulations as part of this emergency declaration, so that we're not shutting anyone off of the program. So we're pushing them out 6 months. So anytime we have to do any of that, that's additional tasks, additional work for our staff in the Medicaid program. And so hopefully, I think those are all the areas that I can think of. But in addition to that, in the child care program during this pandemic, there were many changes made to the child care program to certainly assist those providers out there in the community, as well as those individuals that were accessing child care. So lots of changes there, lots of additional work for the child care staff. Let's see, the energy assistance program. I know we received some CARES Act funding, and so that provided us with an opportunity to do a supplemental payment for the energy assistance program for state fiscal year 20, and those dollars also allowed us to retain that higher benefit amount for state fiscal year 21. Certainly all of that work creates additional tasks and work for our staff. So I hope that answers your question.
It absolutely does, and I think it even answers my next question. I was going to ask you how the approval of these two positions would help SNAP and TANF. So I think you answered all that in there. If there's anything you'd like to add, please go ahead.
I think just the TANF one is important to us, just to ensure that we continue moving forward and we're out of penalty status. We've had the $20 million penalty looming over us for about 5 years. And so, getting that off of our back and being able to move forward is just critical to the agency. So that's the only thing I would add to that.
I appreciate all that information and thank you for all you're doing for our most vulnerable community members. Thank you.
Thank you. I believe Assemblywoman Tolles has questions for 275 and 276. Additional questions?
Yes, thank you so much, Chair. I appreciate the time. So I just wanted to go back to your comments about the workforce participation rate program, and certainly had concerns that essentially for most of the years we have not been in compliance with the standards since 2007, and we've just heard in this committee over the last couple of weeks a lot about various work and training programs, work placement programs through DETR and OWN and GOED and so forth. So just wondering if you could help us understand why we've had so much difficulty meeting those benchmarks since 2007 and what options we're pursuing to make sure that we are.
Sure, if I could, I would like to ask Robert Thompson if Robert could weigh in on that particular question around work participation rates and the background going back. Robert, are you on?
Yes, I am. Steve, are you able to hear me?
Yes.
Good morning. For the record, Robert Thompson, Deputy Administrator, Division of Welfare and Supportive Services. So when we talk about the work participation rates, there are two different work participation rates. There is a 2 parents work participation rate. If there are 2 parents in the home, we are required to have the family working at 35 hours per week in countable activities, regardless of barriers, regardless of issues. 90% of them must be participating 35 hours per week. That is extremely difficult to do, and most states are not meeting that. A single person household with children under 6 years old are required to be working 20 hours per week. And if all children are over age of 6, they must be working 30 hours per week or any countable activity. And the countable activities are determined by the federal government. And the way those activities are counted are countable as positive is determined by the federal government. And I think it's very interesting in that program to talk about it's an all or nothing program. If we're working with the family and they're doing everything right and they're doing their 30 hours per week, but in the last week of the month, they can't get their last day in for whatever reason, we are not able to count them. If they only got their 29 hours in that last week, we're not able to count them. So that measurement by itself does not necessarily measure how successful those families are actually doing. It is a success measurement that was set up in 1996 that is somewhat difficult. Going back to 2007, the agency was not meeting a work participation rate for the 2-parent families. And then as Mr. Fisher indicated, we did not meet the work participation rates for 2012 through 2017. But what's interesting in there is that we were doing a lot of the work. We were not taking credit for all of the work that we were doing because of those excess maintenance of effort dollars not being counted the same as other states were doing it and not being tracked as other states were doing it. So we pulled a team together to start really taking credit for the work that we were doing in all of Nevada, not just in the welfare division. We became successful. So we're not only meeting the success rates now because of the work that we've put into the reporting requirements, which is the position that we've asked for to continue that work forward. We're showing the success, and we have shown the success, and we've actually had unprecedented success. So I don't know if that answers your question, but if you have other specific questions about that work participation rate, I would love to hear that.
Thank you. And that does help. And that does help bridge this budget account with that overarching question is whether or not these specialist positions are going to help us with that. But also just wanted to make sure we're connecting with the other agencies that are dedicated to getting people trained and upskilled or reskilled and working so that ideally they're not on these programs in perpetuity. So just always going to be interested in how we're connecting people with jobs to be able to get back up on their feet to benefit everyone. So I think just that does answer that question in connecting those two. I appreciate that. The only other thing that I'll just say is that I know that there's been challenges sometimes for those individuals trying to meet those work requirements, that 22 to 30 hours a week. Childcare has been an issue. I know we did some creative programs with Tesla with the TANF funds, and that was an issue, transportation and childcare and so forth. So whatever creative ways we can utilize, there's quite a bit of federal funding for helping out with those childcare needs to be able to help those individuals meet those benchmarks so that we're not accruing these penalties over year after year, I think is just important work. And hopefully that specialist position will be able to help make those connections.
If I could, this is Steve Fisher for the record, I could maybe a little bit more information about our relationship and specifically the TANF program's relationship with the workforce development system. We partnered with the Workforce Connections, the one-stop center down in Southern Nevada, and Nevada Works, which is the one-stop center up in Northern Nevada. We have TANF, well, I should say pre-COVID, we had our TANF staff actually physically in those one-stop centers. And vice versa, they took one of their workforce representatives and put them into one of our welfare offices so that they were working directly with our TANF clients as they were entering and into our TANF offices. Once again, pre-COVID, but as soon as things open back up again, certainly we will be right back out there doing that partnership soon. So hopefully that helps show that connection between our program and the workforce development system.
That's good news. Thank you so much.
Thank you. We have one last member who would like to ask a question on E275 and E276, Assemblyman Roberts.
Thank you, Madam Chair. And it's probably more of a personnel question than anything. You know, I notice in your proposal on these positions that you're going to bring them in. It says grade 35, step 7. And I'm just curious on all other hires, and maybe I didn't notice it in the other budgets, but do we specify the step, or do we bring employees in at step 1 when we add a position, or do we normally highlight it that it's unique to a higher step, and then why the higher step?
Good question, Doug. Typically, we bring staff in at a step 1. It all depends on obviously their experience. For example, if we were to, and I'll just use this as an example, we have a contract position right now, and she's been in that position for quite a number of years. So she has experience. She's currently doing the job. She's been doing the job for X number of years. And I'm talking about the SNAP outreach position, the one that we would like to replace the contract position with. So if we were to bring someone like that on, who already has all that experience, certainly bringing her in at a higher step would make sense. That's just an example.
In follow-up, Madam Chair, and I apologize for the simplicity of the question. So is it up to the directors? Who makes those determinations on what step folks come into the system on?
I believe the administrator has the authority to make that decision, I believe.
Okay. Thank you very much. Thank you, Madam Chair.
Thank you. And moving on to E552, we have a number of members with questions. We are going to start the questioning out with Assemblywoman Benitez Thompson, and then Assemblyman Watts and Assemblywoman Titus.
Thank you, Madam Chair. I appreciate it so much. Very excited by this modernization program. So often I'm on the Department of Welfare website, and hats off to you, Mr. Fisher, and your staff, because through sitting on the information technology advisory board, I learned that your website is one of the ones that is 100% ADA compliant. And it's got a ton of data on there. And I know that you folks have worked really hard with EATS on that. That's why this project is exciting to me, because you see how modern some of the welfare, Medicaid, and all that data systems are, the fact that we can see caseloads by month and trends by month. And then you come over to the Medicaid waiver programs, and it's still like a carrier pigeon mailing in applications and paperwork, families bake statements, and then the carrier pigeon gets shut down. You got to start all over again. So I'm really excited about this modernization project. The transparency aspect of being able to see where people are in the process is huge, because I know that for the providers in the community as well as the family, you're just trying to figure out where in the process people land. So within that, can you put onto the record for us a little bit about what the agency anticipates the required advanced planning documents would be submitted to the CMS for approval, and then the anticipated timeline for approval of this project?
Thank you for the question. For the record, Steve Fisher. We have had discussions with our CMS partners on this particular project, and as I stated earlier, it is eligible for 90/10 funding, so we are certainly very positive that it will get approved for 90/10 funding. However, as soon as this is approved, we can submit what's called the advanced planning document. It's just an update to an existing document describing this project in as much detail as we possibly can at this particular point in time, timeline for the project, overall cost of the project, and you submit that to CMS. And then I believe CMS has 60 days, if my memory serves me correct. They have 60 days, so 2 months to review that APD and respond back to the agency with regards to whether it's approved or denied. And so just kind of thinking out loud, we could start this process July 1, 60 days. I mean, we could update the APD right now and get it ready to go. So it's ready to submit. As soon as we submit it, the 60-day clock starts ticking. So we're talking July, August. Then after that, we are planning to hire a contractor, an IT contractor, to come in and do the work for us. So then there's the contracting process that we would have to go through to get the contractor to bring them on board. Once again, I'm just thinking through the process. So we're probably talking between July and, it'll probably take 1 year, I'm guessing. This is a guess, an estimate, probably 1 year from start to finish. Hope that answers your question.
It does. And I hear you express a level of confidence about the fact that CMS will kind of approve the 90%. But on the off chance that they didn't, would that be a deal breaker for this project?
We would have to certainly find a way to get the funding if they do not approve the 90%, then somehow, some way, we would have to identify other funding sources to pay for it. So no, it's not an end all be all, but there would certainly be additional work to find additional funding if the 90-10 was not approved.
Thank you, Madam Chair.
Thank you. Assemblyman Watts?
Thank you, Madam Chair. So you just mentioned the contract process as part of the timeline. I was just wondering if you can clarify, is the contract process, would that be done through a competitive bid, or would the agency utilize an existing vendor? Can you just provide a little bit of clarity on what that contract process would look like?
There is a contract process, a solicitation waiver process, and/or you could go through the full RFP process. However, the solicitation waiver process requires certain approvals. We have had a vendor in the past who has successfully, essentially, built the eligibility engine for us. They're very familiar with our eligibility engine. They're very familiar with our environment, so that particular vendor could hit the ground running quickly. So therefore, yes, we will take a look at the solicitation waiver process. And then secondly, if that's not an option, we would then obviously go out to RFP.
Great. Thank you for the clarification on that. And, I think you've done a great job of explaining some of the efficiencies that could be realized through this project. It's my understanding that, in your interactions with CMS, there's also regular reviews of this system, including security. And I was just wondering if you could speak to any findings from those security reviews and how this modernization would address any of those security issues.
Yes. For the record, my name is Bart London. I'm the Chief IT Manager for the Division of Welfare. We routinely go through a CMS audit. It's a triennial process. In the first 2 years, we answer questions and work on findings from CMS, and we are currently working on findings from our prior assessments and audits. But, as we do anything with the system, we continuously, as we modernize, we continually work on the security aspects of the system, and we continually report to CMS on those enhancements. If that answers your question.
Thank you. I think it does. And so just to make it completely clear for the record, any security issues that are discovered through this ongoing process, you'll work to make sure are addressed in this modernization plan. That's correct?
Yeah, that is correct, Bart London, for the record. We are in continuous communication with CMS and some of our other benefactors to make sure that we are following the highest levels of security demanded for those systems. So it's a continuous process. And as I said, it's a triennial process. And every third year, we are required to bring in an independent auditor to audit our system and report those findings. So yes, it's a continuous process, but we're continuously working with CMS to make sure the system is secure.
Thank you for that additional information. That's all the questions that I have, Madam Chair.
Thank you, Assemblywoman Titus.
Thank you, Madam Chair. I have a couple questions, if I might. First, Mr. Fisher, you mentioned about notification of folks, and if they pass away, who notifies you?
Good question. Robert, do you know the answer to that question from an eligibility perspective? We have
Robert Thompson, for the record. We received that notification multiple ways, direct from hospitals, direct from family members, but we also run a death match through Social Security, and Social Security does automate our systems with what we call alerts. We'll get for lack of a better word, a blip on our system so that we are able to go and update cases when we find out that someone has passed away.
Well, how often do you run those matches with Social Security?
Robert Thompson for the record. I believe those batches are run overnight live, but I am sure they are run at least once a month.
Once a month. And then is it an obligation or mandatory that hospitals notify you or family members notify you when they sign up for this program that you are notified?
Robert Thompson for the record, no, because the only person that has an obligation for us is the head of household, who is normally the person that passed away. So there would be no obligation by the family.
Correct. So the only monitoring really is maybe your once a month matching. So I just wanted that clarified. Thank you. Then my next question is back to one that Assemblyman Watts touched on, and this is the RFP process for this E552. And this is almost $1 million project. And I'm wondering how you came up with that $1 million figure. If you haven't already communicated with some folks that may be doing this, how did you arrive at that figure? Because I have concerns whether or not it'll be enough or where we will be in this process. So could you clarify on how you arrived at that figure without having communicated on with potential vendors on what it might cost to do this?
We have an internal IT staff here at the Division of Welfare and Supportive Services. We do many different IT projects throughout the year, large projects, small projects. So obviously we tap into those resources to take a look at the requirements and what those requirements would take to make the modifications and changes to the system. We also reach out to the software community and get different information from different software vendors just to pull together our estimate, external estimates to come up with once again, it's an estimate on what it would cost to make those modifications and changes.
So I would understand then that CMS mandate that you put it to a competitive bid process if they're paying 90% of it, which would be $900,000, if then indeed it falls within that realm?
I believe, at least my interactions with our federal partners in the past, they leave it up to the state's procurement process, whatever that state procurement's process is.
Okay, all right.
I don't believe there's a mandate that says you must go out to RFP, but I can certainly get back to you on that.
Yeah, I think that's important, and I'm sure the rest of the committee members would like that at the will of the chair. Thank you, Madam Chair.
Thank you. And we'll wrap up the questions on this budget with Assemblywoman Carlton.
Thank you very much, Madam Chair. And I know we've been on this one for a long time, so I'll make my questions as brief as possible. And Mr. Fisher, I just need to get some clarification on a couple of things. On these vacancy savings, this is just a one-year savings, is my impression in reading my documents. I'm concerned about the quality control specialist. That's an audit function, and we have found in the past that those are very valuable to make sure that things are getting done the way we need to get them done. So how many audit positions, how many quality specialists do you actually have? And you're getting rid of 6 of them. So how many will you have left? And then what impact is this going to have on the agency and being able to perform this vital function?
Yeah, these are good questions. Thank you for the question. For the record, Steve Fisher. I don't have an exact number off the top of my head, so I can get that to you. Yes, this will have an impact on our quality assurance team, no doubt about it. The workload will have to be disseminated amongst the other staff, of course. These particular positions provide quality assurance over the public assistance program. So they're reviewing cases that were worked on by eligibility workers to ensure that the cases were determined eligible from a quality perspective. And they report those findings to our federal government. And so, yes, these are certainly critical positions. And once again, the workload will have to be disseminated to the others. Off the top of my head, I don't know the number of quality control specialists that we have, but I will certainly get that to you.
And Mr. Fisher, so they're going to transfer out for a year. Will they transfer right back when the funding becomes available in the next fiscal year? Because this is kind of odd that I've seen through these budgets. We have 1 year vacancies and then they're being filled again. So
Yeah, so
will
for,
that person go back?
so for example, our quality control specialists typically, usually come from a family service specialist or one of our caseworkers. They usually promote over to a quality control specialist because they have all the expertise on our public assistance programs. So yes, these quality assurance or quality control specialists would more than likely move over to or back to a family service specialist position. And then after 1 year, certainly we would give them an opportunity to come back over to the quality control specialist position if they choose to do so.
Okay, and that takes care of that. I have concerns about keeping a position vacant for a year and then bringing it back. So it's just a weird gap year there. So as far as on the training part of this, how much will this affect IT training? Everything's constantly changing. I have to be retrained on all this stuff all the time to make sure that I can even operate the computers that are in front of me. So the reduction in the training expenditures, what impact is that going to have on your staff?
Yeah, that'll have a significant impact. I mean, certainly, especially for our technologists, they have to constantly keep up to speed on the latest and greatest technology so that they can support the agency. Certainly, there's also training that our staff have to take. So, for example, when we moved from the old Office products to Office 365, certainly it's the same Office products, but there's a lot of nuances, and so that requires possibly training. So, yeah, certainly, anytime you reduce your training budget, folks will possibly go without training for a period of time until such time we have the funding again.
And it's my understanding that these platforms support the child support functions, eligibility, payments, things that are pretty vital to our constituents.
Yes, the platforms, yes, the system supports our family service specialists to determine eligibility, as well as the child support enforcement system as well. That is correct.
Okay, thank you very much, Mr. Fisher. Thank you, Madam Chair.
Thank you. And that will end the questioning on that budget. We'll move on to our next budget, which is 3230. Mr. Fisher, if you'd like to go ahead.
At this point, I'll turn it over to Mr. Thompson to walk the committee through the 3230 budget account.
So, good morning. For the record, I'm Robert Thompson, Deputy Administrator for the Division of Welfare and Supportive Services. Slide 15 is an overview of our temporary assistance for needy families. TANF is one of the programs that's under my purview. As Mr. Fisher already indicated, the Temporary Assistance for Needy Families program is really designed to care for dependent children in their home or in the homes of relative caregivers. The TANF program covers cash assistance, workforce development, and other activities throughout Nevada that meet the 4 purposes of TANF as set in federal guidelines. For Nevada to utilize the TANF dollars, the division must ensure that the funds are being expended to support families with minor children, and the language of the 4 bullet points that I'm going to give are direct out of federal government. Some of this language may sound antiquated, just reminding that it was set up in '96 and this is federal language. The 4 purposes require that to allow children to be cared in the homes or in the homes of relatives, to end the dependence of needy families on government benefits by promoting job preparation, work, and marriage, prevent and reduce the incidence of out-of-wedlock pregnancies, and encourage the formation and maintenance of 2-parent families. The TANF regulations require that the families be working to meet certain work requirements. And we went into depth a little bit of that during the Q&A session, so I won't take up your time unless later on you want me to go back into that further. Next slide, please. Slide 16 is really tied to our caseload. Mr. Fisher talked about caseload, and this requests the funding showing the current decline and then a small increase later. Next slide, please. The slide 17 talks about our enhancement units. Enhancement unit 280 request funding to identify a vendor who will support a vocational training program for low-income youth. And this approach is actually a two-generation approach in TANF to assist us with, we use TANF a lot to assist the adults, but we don't necessarily use enough of our TANF to assist the next generation to make sure that they come out of poverty and stay out of poverty. This approach is designed to fight poverty, but also fight the future possibility of poverty. And in this program would provide mentorship skills and training to guide a high school student who's likely at risk of dropping out toward a trade, toward schooling, and sometimes even the final goal could be military. This support would be designed to assist in providing a stable future, but the overall focus is actually education. E-Unit 350 request funding for nurse-family partnership to allow trained public health nurses to conduct one-on-one home visits to first-time low-income participating mothers and their children to reinforce positive maternal behaviors, focus on prenatal care, care for the infant, and encourage emotional, physical, cognitive development of these young children. The overall goal of this enhancement unit is a healthier outcome for low-income children. This concludes budget 3230, and we would welcome any questions.
Thank you. I know we have a number of questions on this budget, and we're going to start with Senator Ratty.
Thank you, Madam Chair. Could you provide an update on the TANF cash assistance caseload and what factors are contributing? It's a weird year, right, with the pandemic and everything that happened in 2020. So it seems like they're leveling off. So can you just give us some context and perspective on that?
So the TANF caseload did drop this year, which was completely unexpected for us. We saw our other caseloads increase, but we saw TANF decrease. I believe TANF is in the range of approximately 20,000, approximately 17,000 recipients at this time. One of the biggest factors that we believe is impacting that caseload and causing the drop is that unemployment is approving differently than it ever did in the past. Unemployment approvals now include gig workers, the Uber drivers, people that do hair for a living, and that wasn't true in the past. So in the past, when we hit the economic bumps in 9/11 and the 2008 housing bubble, those people had no other safety net. Now they have unemployment. If the base unemployment is higher than the TANF payment rate, they're not eligible for TANF. So we do believe that's contributing to it. We've run recent data analytics and we are showing 240% increase of denials and removal of TANF due to income during this pandemic. So we are attributing that to unemployment.
Thank you, Mr. Thompson, for that explanation. And could you just clarify for us on that? So if that makes sense from the unemployment standpoint, but for an individual who's on TANF who receives just one of those one-time stimulus payments, so like the $1,200 or the $600 or whatever future, does that bump them off of their TANF or SNAP or anything else, or is that excluded from determining income? It would be terrible if folks were having to drop off for a month or two.
No, it does not. The Robert Thompson, for the record, the one-time payments have not been counted. I should not say never. We don't know what the future bills will say, but previously they were not counted. One-time payments are not usually counted at all. We did see in legislation during the first CARES Act customers were receiving an additional $600 a month of unemployment. That was countable in the food stamp program, but was those additional monies that are now 300 are not countable in any of our programs.
Okay, great. Thank you. Appreciated that.
Thank you. I have Assemblywoman Carlton next.
Thank you, Madam Chair. So I'd like to ask a couple questions on the youth training program. This just seems to be a bit odd in this particular budget. TANF is based on helping parents succeed. There's a lot of youth programs out there. I know there's a lot of federal money through all different other types of youth training programs. I'm just a little concerned that we're using very valuable TANF dollars that could be going to child welfare and other places for a training program. So I guess I just want to understand what the thought process was behind this. And when I look at the description of what the program looks like, it looks very similar to some other programs that are already in existence in the state. So if you could just elaborate on where this came from and why we would use precious TANF dollars that have not been increased for 20 years for a program that could be funded someplace else.
So Robert Thompson for the record. Oh, excuse me. Robert Thompson for the record. I'm sorry, I've got a tickle in my throat. Robert Thompson for the record. I completely understand what you're saying. The conversations for this type of program, we have been having conversations with our TANF partners, and there was a lot of conversations about the second gen approach of us using TANF dollars to assist teenagers that are on TANF to make sure that they don't repeat the cycle. That's where the conversation started. And Director Whitley was in huge support of using these funds to shore up some type of existing program just to continue breaking the cycle of poverty, hope of future generation not being on TANF.
And thank you very much, Mr. Thompson. And I totally appreciate the work. Go ahead and mute yourself and get that cough out. I totally support what you're trying to do. I just don't think this is the appropriate budget account to do it from. And I just have concerns. So do we know who this sub-grantee is going to be and how quick will it get up and running?
Robert,
or is it already existing and we will be funding an existing program?
Robert Thompson for the record. The plan was to support an existing program. But the existing programs have not been identified, and we would be putting it out to the public for public input on who we used.
And thank you very much, Mr. Thompson. And again, Madam Chair, I support the idea. Youth training is very, very important. It's just these dollars are so precious and have not been, like I said before, have not been increased for 20 years. I believe Dieter probably has a number of different silos where dollars can be used for a program along this line. So thank you very much, Madam Chair.
Thank you. We have a few more questions. We're going to go to Assemblywoman Benitez Thompson and then Senator Kekeffer, and we'll finish up with Assemblywoman Tolles.
Thank you so much. So my two are really quick relative to caseload and caseload changes. You talked about the number of denials that we've had. Do we know the number of Nevadans who are no longer eligible for TANF just because they've hit their 5-year lifetime limit, for those who have the lifetime limit and who aren't otherwise exempted out?
Robert Thompson for the record. I do not have those numbers in front of me, but I can tell you that we have not seen an increase on the number of people timing out. Timing out has never been a large percentage of our TANF caseload drop-offs in Nevada. The average number of months that a TANF recipient receives benefits in Nevada is about 14 months. And the lifetime drop-offs are very low percentage of our customers that we lose.
Great, thank you. Thank you so much. I appreciate that. And then real quick, if you could remind me, I think we've had some policy changes over the years. For some reason, I'm uncertain at the moment. So in the work requirements for the TANF participants, can't remember how much educational work is allowed to be counted as work hours.
Robert Thompson, for the record, certain education benchmarks are allowable. It is a complex program, and it gets very complex. Persons that are trying to achieve their GED can only count those hours until they reach a certain age. And after a certain age, it's no longer countable unless they're working 30 hours a week here and doing their GED there. So those benchmarks are set by the federal government, but it's not education is education. It's the type of education, it's what else they're doing with, if they're working and going along with education, and it's called core and non-core hours, and it's a whole holistic model.
Okay, thank you so much.
Senator Keffer.
Thank you, Madam Chair. My questions were along the same lines as Assemblywoman Carlton. I was reading about the vocational training program. It just sounded like you were describing the JAG program, which we already fund in a number of ways. And while I'm not averse to spending some of these dollars on youth training and youth workforce development, I would just want to make sure that any funds that we put out would be supplemental and not supplanting for any other revenue streams that are coming in for these outside organizations. So that's probably more of a statement at this point, Madam Chair, but I'll leave it there. Thank you.
Thank you. Assemblywoman Tolles.
Yes, thank you, Chair. And my questions had to do with the new Nurse Family Partnership Program. Is this still an appropriate time to ask those questions?
Yes.
Okay, great. Thank you. And if you could just discuss some of the primary issues that this program seeks to address and how the participants will be identified. Not sure if we covered that, and I do have a couple follow-up questions.
Robert Thompson, for the record. The participants would be partnering with our community partners, doing our outreach, and the participants would need to sign up for the program. I don't have specifics of how they would link in to sign up at this time. Once we built the program, we would have those specifics out to the community. And I think I missed the second part of your question. I'm sorry.
No, that's okay. Actually, that was just how they would be identified. So I think your answer was that it would, go out to the community and they would have to, it would be promoted and it would be based on who signs up for the program.
They would have to sign up for the program, and for the purpose of TANF to be used, they would have to be determined low income based on a poverty rate that was set in the contract.
Great. And is that, my understanding, it looks like a great program to just, go into homes and really help these new first-time parents. And is that used the comprehensive model of care? Is that, since it's a nursing program and so forth, it's a medical model program from what I understand?
So it's the Nevada Family Partnership it's a partnership with the Department of Public and Behavioral Health. And my understanding is that they would have measurements of success in the areas of improving maternal, newborn, and child health, preventing child injuries, child abuse and neglect by having nurses in the home. They would be able to see right away if there was child abuse, neglect, or maltreatment, which would reduce the number of emergency room visits. The hopes to improve school readiness and child academic achievement, possibly reductions in crime and domestic violence by having nurses in the home, overall improvements of family economy and economic self-sufficiency, right? If the nurse is in the home and they see that this family may qualify for TANF, they can connect us back to TANF and do that education. Not all families are reaching the supports that are out there. There would be a nurse in the home doing coordination and referrals of community services and getting those supports going.
Thank you. I really appreciate this. Having served on a task force for child abuse prevention many years ago, this was one of the recommendations. And so definitely caught my eye when I saw that this was on our list of things, and eyes on those kids in the homes is so incredibly important to helping reduce child abuse in particular. My last quick question is in a general broader scope, how many TANF reserves do we have today? And what threshold does that put us at sort of percentage wise in terms of TANF reserves on hand?
So I think in the presentation on one of the slides, there's for the record, Steve Fisher. TANF reserves are projected to be about 31 million at the end of the biennium. We certainly try to run a 90-day reserve, and if my memory serves me correct, that 90-day reserve would be about 15 million. So hopefully that answers your question.
And that's the projection at the end of the biennium that we're discussing right now. So what is it today on hand?
Today's reserves would be, off the top of my head, I believe it's 38 million. Unless Brenda, do you know the answer to that question?
Morning, this is Brenda Berry for the record. I do not have that at hand, but I can forward it on to the fiscal analyst.
Great, thank you. And so basically by the end of we're projecting that by the end of the biennium, we'll have 31 million. Our goal is to keep a 90-day reserve. So that leaves about 16 million or so that potentially we could take a look at as we're having these discussions. Right. It still keeps us at that 90-day reserve.
Yes,
that's correct.
Thank you.
Thank you. And we have our final question from Assemblywoman Carlton.
And thank you very much, Madam Chair, for recognizing me a second time. This isn't actually one of the items that's here, so I wanted to take it separately when I was going through this. And then I did receive some communication from Clark County about them not being a recipient of the TANF grants right now. In the past, they have been a partner with the state in this. They've provided information on the maintenance of effort. And I was just wondering where we are with that. I mean, we just heard last week about the cuts to foster care. And now here I see in this TANF grant that those dollars won't be continuing in the next budget cycle. So Mr. Fisher, if you could address that, because that will have significant impact on the children in Washoe and Clark County. And if it's better taken under the child welfare question, that's fine, but it's actually a grant out of this budget. So I wasn't sure where to ask it. So there you go.
Sure, thank you for the question. As I testified to a little bit earlier when I was talking about the work participation rate, I did make mention that both Clark and Washoe do contribute via the work that they're doing in their child welfare system. They do have dollars that they put into the child care welfare system that can be used for maintenance of effort. And yes, we do receive those maintenance of effort dollars from the counties. In December, we went to before IFC and we were approved for $5 million to really restart the funding to Clark and Washoe for their emergency assistance program. I believe that's what you're referring to. I think prior to the Great Recession, we did provide TANF funding to both Clark and Washoe for their emergency assistance program. That stopped in 2008, 2009. We did provide some funding, I believe, in 2018 for the program. And again, we just provided $5 million startup for, and going forward, I can commit that we will continue working with the counties. We want to continue supporting the emergency assistance program. So hopefully that answers your question.
It does, Mr. Fisher. I appreciate it, but if it's not in the budget, we can't do it. You have to have something in the budget to be able to get there. So I think we just need to have some further conversations. This is just 2 weeks in a row we've seen impact to these types of services in the 2 largest counties. So I think we're just going to want to make sure we have a global discussion about how these dollars are spent. And I know there's going to be a reserve left over, but I also know with some of these enhancements that you're looking at, that won't necessarily, and depending upon what the fines are like, work participation, I know that's a variable, but I think it's important that we have the conversation about having these funds move forward through the next budget cycle in some way, so that if there's a way to get them even more money in the future, there's an avenue to do it. So thank you very much, Madam Chair.
Thank you. And I apologize. I missed Assemblywoman Titus, and then we'll wrap up with Assemblywoman Benitez Thompson.
Thank you, Madam Chair. I appreciate the opportunity to ask the question. Mine's in regards to the E35 program, and I know Assemblywoman Tolles commented on it, but I have some questions regarding the funding to a third-party organization that's going to provide visits from public health nurses. Who's that third party that you're contracting with?
I'm sorry, I was muted. Robert Thompson, for the record. We would be partnering with Department of Public and Behavioral Health under DHHS, and it's my understanding that the actual vendor has not been identified.
So you're going to find a third party, somebody else is going to find that third party for you. You don't know who that is. I'm just curious about the whole global concept of that staffing, those nurses, the availability. And so I have concerns, and I would love to see more details as this moves forward, if indeed it does, because I think conceptually, everybody wants great prenatal care, but I have concerns. Then my next question is, under your eligibility for this, and the whole thought process is you have, how are you going to find these folks that you identify? And although I appreciate Assemblywoman Tolles' comments regarding, hey, this is something that was identified to help with child abuse, et cetera, a lot of these questions and criteria require that the recipient participate in that. So I'm wondering if you're going to require that they fill, I know it's a volunteer, they have to agree to do this, but you're asking about tobacco use, you're asking about, did their students have low achievement scores? Do they have disabilities? All these things are fairly personal, and I'm just wondering about those questions. And my final question is, have you modeled this after any other states that do these programs? Their success rate, what they've accomplished, and I'd really like to see a much more detailed breakdown of this type of program. It sounds great, but then reality, the devil's in the details, and I'd love to see what you're modeling after and their success rates, their participant rate, because there's a lot of money's being spent, all with good intentions, but there's other programs that are so needy of funds that have established results that this sounds great, but I'm just really have huge concerns. So I guess I want to answer at least one of my many questions that I've thrown out here is, how did you sort this out, tease this out, and what are you modeling it after?
So Robert Thompson, for the record. The modeling was discussed through the Department of Public and Behavioral Health. With everything that you talked about was the measurements of outcome, and there was data-based success benches that were modeled after other states. I would have to ask to see if Mr. Fisher could jump in at this time. I don't have the specifics in front of me that you're asking. We could pull them together and send them.
For the record, this is Steve Fisher for the record. We'll be happy to get together with a representative from Public and Behavioral Health and sit down with you and certainly share the evidence-based, it's an evidence-based model that is occurring in other states. So we'll be happy to sit down with you and share that information with you if that will work.
I'd appreciate that, and I'm sure that through the chair would like to see some details also. Again, these sound like great ideas, but again, seeing how they work, best use for our dollars, those are the questions I want to know, or answers I need. How do people sign up? It's a big invasion of some of their privacy, some of these questions and qualifications to this program, and then outcome data. Those would be the things certainly I would looking for, and maybe others would want more questions, but definitely would need some more details. And I thank you, Madam Chair, for the question. Looking forward to further conversation.
Thank you. And when you do gather that data together, if you could send it to our committee secretary so every member on our committee can get that information. And I think we have a follow-up with that will end this budget with Assemblywoman Benitez Thompson.
Thank you, Madam Chairwoman. And I'll be really quick. So very enthusiastic about this program as someone, in my profession, we talk a lot about, the theory of a person and their environment. And so when you meet people where they are and you're providing support in their environment, you just get such better results. So taking nurse and support into home for mom and baby is wonderful. I guess the one thing I want to put on the record, and as we have discussions about this program, is just whether or not we want in the language to specifically say nurses, like a registered nurse and RN, or if we want to leave it open to other licensing types. I just think with the shortage of RNs, it could be very hard to fill this. And we launched many great programs only to come back 2 years later and realize we couldn't find the FTEs to staff them. There looks to be a clinical piece prior to during the pregnancy that I imagine an RN could fill, but post-birth, it looks to be a lot of coaching on good habits for mom and baby. And so that I just think we might want to perhaps leave it open to different, maybe not be specific about different licensing, specific to one licensing type, but really leave it more open so that we can let this program kind of organically grow with the resources that are available in the community at hand.
Great suggestion, Assemblywoman. Thank you. So with that, we will end the discussion on 3230 and we will move on to budget 3233. Administrator Fisher, you can go ahead.
I will turn it over to Robert Thompson.
Thank you. Again, Robert Thompson, as Deputy Administrator for the Division of Welfare and Supportive Services. Slide 18. Are we on? Okay, thank you. The slide 18, 3233 is what we refer to as our big three programs within the Division of Welfare and Supportive Services. This budget supports our ongoing efforts to provide a safety net to almost 800,000 Nevadans now via our family services specialist to promote food security and health using our TANF, SNAP, and Medicaid programs. The Medicaid program includes medical assistance for the age-blind and disabled and Nevada Checkup. And throughout our programs, our SNAP and TANF programs, we also promote workforce development through those employment and training programs. Next slide, please. Slide 19, our M201 unit requests funds to support an increase in projected tasks, actions, and overall caseload. We are seeing the caseload increase. This request adds 226 positions in fiscal year 2022 per our staffing methodology that we've used through the last few sessions. And those appendix are located on slides 35, 36, and 37. And as Mr. Fisher said earlier, we have included in slide 40 a DHHS dashboard so that anybody can go in and see the geographical locations broken down by district and counties of the population that we're serving. With this increase in caseload, we are now averaging over 192,000 unduplicated tasks per month. That's up from 144,000 tasks last legislative session. One of the saving graces for us right now, though, is that there are waivers in place allowing us to skip the TANF interview and process TANF the same way that we are processing Medicaid. So the average time per task is down to 41 minutes, which is one of the reasons that we are even possibly staying caught up at all, keeping in mind that we are not really staying caught up. Our backlog right now is double the norm, and our tasks being worked are almost 10 times the norm of what we are this time of the month. The workload is just coming in faster than we can stay caught up. We have a team who reviews our staffing methodology quarterly. And I thought this was important to talk about because there was conversations in the past that if we received 226 positions and in the future the caseload started to project, there might be fear that Nevadans would be displaced from their positions. And I wanted to point out that my team meets quarterly to go over these staffing projections. We don't wait until we're building for legislative session. We do this constantly. So we know far ahead of time if the caseload looks like it's starting to drop. And this allows us to pre-plan and never be in jeopardy of having anyone displaced or laid off from their job if the caseload's beginning to decline. For example, last legislative session, we anticipated returning about 100 positions. We started planning that a year ahead of time and started holding positions through normal attrition to avoid layoffs because the caseload staggers down and we're able to stagger staffing down. If approved for these 226 positions, they would stagger in through our training academy, as training academy is extensive and is several months to bring a case manager up to speed. Enhancement 232 requests to add 1 social services manager and 9 workforce service representatives to support the recovery-friendly workplace concepts in Nevada. And this concept is being modeled after New Hampshire's recovery-friendly workplace program. The recovery-friendly workplace program supports their communities by really recognizing recovery from substance use disorders as a strength and works intentionally with people in recovery, tying recovery to employment. A recovery-friendly workplace program encourages a health and safe environment where employers, employees, and the community can collaborate to create positive change and eliminate barriers for Nevadans impacted by addiction. Now, this unit would be designed to work with the community throughout Nevada to identify employers who would be willing to engage with persons in recovery to utilize employment as a support system for the person living with a substance use disorder, rather than employment being the final goal. Historically, employment was the goal. We would bring the neon TANF recipient in. They would list substance use as an issue and a barrier to employment. And the thought and the plan was always to put them in counseling, work through every one of their barriers with the final goal of being employment. Well, under this concept, work becomes one of their resources. And we now know that employment provides support. It provides purpose. It provides you a place to go every day. It provides a goal, and it even gives people an additional social network, which is true for anyone in recovery and anyone out of recovery, right? The workplace is a social network. These new TANF specialists, staff specialists, would not be managing the TANF recipient who is living with a substance use disorder. We have licensed social workers on staff who do that. We would not stop using our licensed social workers. The licensed social workers are the one-on-one case managers to help people with these kind of significant barriers. These employees, their job would be to work with workforce development, connect with Job Connect with the community, and identify employers who would be provided as a resource to the social workers to assist in engaging the TANF customer using employment during recovery. Next slide, please. Enhancement Unit 228 requests funds to increase bandwidth for 2 of our division offices. I'm not going to go into depth about that. IT, they don't have enough bandwidth and things aren't working the way that they should be working. Enhancement Unit 685 is a significant request, and I know it's going to create a lot of conversation. So I thought I'd take a moment really to dig in here. This request is to eliminate 4 division offices, and 3 of those division offices are face-to-face service offices, and maintaining 67 vacant positions throughout fiscal year 2022 with reinstatement fiscal year 2023. This enhancement will have an impact to our community, and this was because of our 12% budget reduction that we had to look at. Setting 37 positions vacant for a year is the equivalent of an entire small office not running. It's equivalent to more than an entire outreach team. And holding these positions open could contribute to reduction in timeliness, reduction in accuracy, and reduction in services to the most needy and vulnerable of Nevadans. Also, as part of our 12% budget reduction, we have analyzed all of our district offices to look at the locations to determine which offices we could close that would have the least impact in Nevadans we serve. And as Mr. Fisher said previously, DWSS has 19 front-facing offices throughout Nevada that provide face-to-face services. Las Vegas is the only city that has more than one office available to the public. Elko, Ely, Reno, Sparks, they only have one office. So when we looked at where to close offices, it had to be Las Vegas. Of the 19 offices that offer face-to-face services, 10 of those are located in Las Vegas, and all of the office closures in this unit are located in Las Vegas. The offices that we're looking at are Warm Springs. Warm Springs is a processing center and it has no contact with the public. Decatur is a small office located at Decatur North 215 in North Las Vegas, and it was opened in 2014 as part of the Affordable Care Act expansion. And the nearest office to that is the Craig office, which is about 4 miles away. Spring Mountain is an office located at Spring Mountain and I-15, and that's in central Las Vegas. Also opened around 2014 as part of the Affordable Care Act. The closest office to that is the Belrose office, which is about 5.5 miles away, and the Flamingo office is about 6 miles away. The last office we're discussing is the Durango office, and this is a small office located in Northwest Las Vegas on Durango, near Flamingo. It opened around the same time as the others. The closest office to Durango is Flamingo, which is 10 miles away, a straight shot down Flamingo, 10 miles. Belrose is also 10 miles away. To offset and mitigate and continue face-to-face services for our customers throughout Las Vegas, DWSS would constantly be evaluating with our partners to expand our outreach sites, and not just in Las Vegas, but throughout all of Nevada, to continue providing face-to-face contact and non-traditional access points. That would be post-COVID. And also keeping in mind that anybody can apply online for benefits. Our actions, approvals, and updates can be addressed anywhere in the state, as Mr. Fisher said earlier. And I would like to open for any questions for 3233.
Thank you. I know we have a number of questions, and we will start out the questions with Assemblyman Watts.
Madam Chair, I appreciate some of the context that you already provided on the review of caseloads and the quarterly updates to that and how it relates to your staffing. I'm also looking at some of the caseload projections and saw the large projected change between FY20 and FY21 for Medicaid in particular, also energy assistance, and then some large projected caseload growth in FY22 for CHIP and energy assistance. So I was just wondering if you could provide an update on where those caseloads are at and what factors contributed to those significant projected increases.
So Robert Thompson, for the record, the energy assistance program is a separate budget unit that we will be discussing shortly, but energy assistance is a very small program in comparison to the rest of our programs. And the biggest increases that we've seen are Medicaid and SNAP. We've had an increase in applications, increase in need. And in the Medicaid program, we are not allowed to shut cases down unless the recipient has those 3 specific reasons: moving out of state, passing away, or withdrawing from benefits. And we're not seeing anybody withdrawing from benefits. The Medicaid recipient number is reaching right at 800,000. And I believe food stamps is teetering right at 450,000. And Mr. Fisher, if I'm misspeaking, please jump in.
No, that's the number. I don't have them in front of me, but that sounds right. Close to 800,000 on Medicaid and 400-some-thousand on SNAP.
Robert Thompson, for the record, one of the things that we talk about in Medicaid is Medicaid numbers are counted separately from Children in Nevada Checkup. So you'll hear about Medicaid and then you'll hear about these total numbers and it will look like they're off by about 20 to 30,000. And the difference is just usually Nevada Checkup. Did I answer your question?
Yes, and I have a follow-up, Madam Chair, that will probably get some more clarity on this. So it sounds like one of the major factors is the narrow list of specific reasons for how people move off the Medicaid rolls, particularly for that. Obviously, the economic impacts of the pandemic, I think, are another. And so could you just speak specifically to how the pandemic has impacted the workload for the field services budget, and how the current projections look at that, how that's going to change or not change over the biennium?
So, Robert Thompson, for the record, we saw the sharp increase in tasks and applications and workload coincide directly last March when the hotel industry started laying individuals off. So it is definitely COVID related, and the incoming volume has just been increasing as Nevadans are becoming more and more in need. We do know from previous events, I've been with the agency for almost 25 years, and we saw after the 9/11 economic event and after the 2008 housing bubble economic decline, that the welfare division is usually a year to 18 months behind the recovery. As the economic recovery starts happening, the welfare division does start seeing a drop in caseload, but it can take a year to year and a half before we actually flatten back out. Because our systems are built in, so there's not a cliff effect. We try to ease people back off depending on the program that they're on. How the projections are actually done are through the Office of Data Analytics through DHHS, and they are given to us based on everything from housing sales to unemployment projections. And they put all of that together and put that in the packet. We receive the same packet that you do.
Thank you for that. I appreciate that additional context. I can see in these projections the sharp increase, and it looks like that will continue over the course of the next year or so before kind of leveling off. And so it sounds like that is also consistent with what we've seen in previous recessions and economic downturns. So thanks for the clarification on that. That's all I have, Madam Chair.
Thank you. I have Assemblyman Roberts.
Thank you, Madam Chair, and thank you for the presentation this morning on this budget item. And I truly appreciate what you're trying to do to deal with your increased caseloads, and you're adding a significant amount of personnel. And back to that question again, I'm looking over the breakdown of the 226 positions. I see a variety of grades in the administrative assistant and multiple grades in the service manager and family service specialist. Can you explain the difference for the need and the different grades for those employees and those duties?
Robert Thompson, for the record. I'm sorry, I keep pausing to see if my administrator is going to jump in. We're not in the same room, so it's hard to tell who's going to speak. Robert Thompson, for the record. We have a staffing methodology that, this is in general speaking, but for every 10 family services specialists that we need to push out the benefits, we need a supervisor to oversee that team to keep it going. For every 20 family services specialists we have, We need one lead worker because our lead workers do our training and keep the team moving with updates. Our updates come constantly, and that lead worker is the specialist of the units. For every 80 to 160 to 120 positions, we need a manager to oversee that. And when we're looking at 226 positions without having offices for them to go to, we are planning to have these individuals working from home. We plan on 30% of them to be working at home the same as they are today, which has proven to be a very efficient model. But we would be creating, for lack of a better word, virtual offices, and somebody still has to oversee those. When we use our administrative assistants, those are also built in to the model because we receive a lot of paper, and our paper has to be sent out. It has to be moved around. And what we built is a model that uses the correct job classification, so we're not overpaying a family services specialist with our tax dollars to move administrative work or to issue EBT cards. So we have a grid and a model that we work with that says this many family services specialists that you need equals this many supervisors, managers, clerical staff.
Yeah, so I understand that.
I'm sorry, I missed
Yeah,
that.
that's right. My other, more pointedly is like for a breakdown here, you have 33 administrative assistants at a grade 23, and you have 7 administrative assistants at a grade 25, and then 1 at 27. The same with family support specialists, 160 at grade 31, and then 8 at 32, and 50, obviously there's supervisors there. So what's the difference between the 2 administrative assistants and the 2 family service specialists? Why the different grade? Just curious.
I'm sorry, I didn't understand the, Robert Thompson for the record. The different grades on the family service specialist, one is the service delivery worker. The higher grade is the lead worker. It's the subject matter specialist. For the administrative assistants, we have different levels of duties. So the more complex the duties, we use a higher level specialist for administrative assistant. We try to always keep the lowest level duties to the lowest paid position, but as the duties become more complex, we grade them up.
Thank you. And in my final, Madam Chair, and I'll be done. So both these folks can come in a variety of steps, just like we discussed before, based on their qualifications.
Robert Thompson, for the record, it is our practice to bring them in at step 1 if they are coming in off the street, for lack of a better word. Internally, if they're promoted, they're set to step by HR. It is rare in 3233, and I do not recall doing it except for once and twice in my career of asking the administrator for an exception to bring somebody in above step 1.
Okay, thank you very much. Thank you, Madam Chair.
Thank you. Senator Ratty, did you have any questions on this section of this budget?
I do. Thank you, Madam Chair.
Thank you.
So could you just talk a little bit more about the model that's used to identify and address caseload increases? I think that's not something that everybody's familiar with, the third party and how you really work through these caseload increases.
Robert Thompson, for the record. I'm sorry, I'm not sure I understand the question. Are you asking how we do the projections?
For specifically how you do the caseload projections and how they become staffing needs. So specifically how that connects from caseload projections to the staffing, the caseload and the staffing needs.
So Robert Thompson, for the record, our agency uses a task-based system that tracks how many tasks each employee does. Every FSS that works is in this system. They're always working in the system, and we can track how many minutes it takes to do each type of case. And we break it out into groups. TANF cases are the most complicated, complex, and we get an average of how many minutes that takes. We average that out through the 18 months, so we're always looking at an 18-month period, and we determine how many tasks we can do per month per employee. Right now, I believe I said we were processing 192,000 tasks at 41 minutes. Then the Office of Data Analytics will project forward, and they will come back and say, we project in the I'm going to make it up right now, but we project that your increase is going to go up by 6%. So then we project that our tasks are going to go up by 6%.
Perfect. Thank you. And then this budget recommends 35 positions that would start on July 1st, which oftentimes we don't start new positions until a little later in the year. So can you just talk a little bit about how you would get to that, hiring those positions, and if the projected caseloads don't come forward, what you would do?
Robert Thompson for the record. The first piece of your question, we have an academy set up and we have a hiring panel set up. That the hiring panel runs constantly because we normally hire every quarter for that academy to start our hiring. We are set and ready to go. If we get the idea that we're going to be able to hire, we have the system set up and the academy set up, and we are ready to go to hire those positions. There is not any concern on my part that we couldn't have those individuals in place. We opened the family services specialist position last week. We anticipated it to be open, I believe, for 10 days. They received so many qualified applicants within 3 days. DHRM closed the list. So there is a need for people that want to come to work for us, and we are set up to hire them. The second part of your question, I'm not sure I understood.
So this hiring is based on caseload growth. So if that caseload growth does not materialize, then what happens?
Robert Thompson for the record. If the caseload growth does not materialize and we start seeing that ahead of time, we would, I call it a soft freeze because it's nothing official from DHRM or the governor. It's an internal soft freeze on hiring that we put in place because we start projecting out and we know that we're going to come to legislative session and the caseload is going to start decreasing, and we would never want to place any Nevadan in jeopardy of losing their position. So when, for example, last session, we knew that we were going to be losing about 100 positions. I met with my hiring team and I said, okay, now for every 3 openings you have, you can only hire 2 people. And then we met quarterly and we kept adjusting that until we knew we had enough vacancies in place that when we went forward, no one would be displaced and we were giving back only vacant positions.
Thank you. That's a great answer. And then on October 1st, there's another 122, and I'm assuming an academy can handle another 122 if they all came on at once.
Robert Thompson for the record, yes, the academy itself can handle 96 positions in Las Vegas. There's an additional academy in Northern Nevada. And then our smaller offices such as Elko and Ely, they don't have academy, they do on-the-job training or they link in virtually. So we are confident that we'd be able to bring them on board and do the hiring without an issue.
Right. And Madam Chair, can I ask just one more follow-up question?
Go ahead.
Thank you. I'm just curious, we've heard some really wonderful things about having some of your team over at the DETR offices. I know they're working overtime to support DETR, but how that is then giving us a more holistic approach with some of these individuals because you have the TANF or your team so closely working with the unemployment team that there's some problem solving that can go on there. Are we taking any lessons from that? Is there any way that we're going to be able to continue that once this unusual arrangement of your folks working overtime for them ceases?
Mr. Garcia, would you like to take that and claim the glory for the DETR job that you've done?
Yes, Joe Garcia for the record, Acting Deputy Administrator for DWSS. So first, I would like to point out that they're working in different systems. So our staff, the 200 staff that are working with DETR, are working in 2 different systems for DETR, and then they work in our systems here for DWSS during the day. the biggest takeaway is going to be that those 200 staff we have working the overtime are going to have a very good familiarity with UI or unemployment regulations. Therefore, when they're doing their DWSS job, they can point our clients in the right direction and have a better understanding of unemployment insurance regulations, and probably be better able to give our clients an idea if they're going to be eligible or not. Certainly, they can't do that without being in the UI systems. And when this collaboration ends, their access to those systems are going to be closed. I wish we could have something a little more of this wraparound that we're doing right now, but it just isn't feasible. I think in the future, we are certainly going to be able to talk about that, because all of this is web-based. So our staff, we have some of our staff working from home, are also working the DETR overtime from home. So we can certainly do all this because it is web-based, but each division has their separate budgets, their separate rules, and I'm not sure how we can incorporate that DETR work into DWSS work and vice versa. It's a wonderful concept and a fantastic idea, but with all the red tape that we have to go through already, I'm not sure how soon something like that could happen. I can certainly speak with our partners at DETR, and really that's all I can tell you right now about how that collaboration might continue or benefit the clients that we serve. And, unfortunately, it's only 200 of our staff that have been able to work through this for the last, since late August of last year through now. And I hope that answers your question.
It does. Thank you. And just express our gratitude to those employees who've been working so many hours.
You certainly will.
Thank you. Senator Hammond?
Thank you, Chair. I appreciate the opportunity to ask a question. Mr. Thompson, it seems like after hearing the discussion so far about staffing, about caseloads, I've heard sort of your equation that you use or try to use in order to determine your staffing levels. It seems that just sort of projecting how many caseloads you might have and how long it takes each person who's working on these caseloads to get through them. It seems like a major part of your job, just the projection part of it, but it seems like that's one half of of the staffing equation, is trying to figure out how many cases you might have in the future based on circumstances that you guys have probably a better idea of. But I want to go back to what Assemblyman Watts and I think Senator Ratty had kind of talked a little bit about, and that's talking about how do you determine the caseloads when it comes to the decrease in the caseloads. You mentioned that there's 3 ways that caseloads could go down, one of which doesn't happen at all, and that's when somebody asks not to have benefits. But the other 2 were if somebody passes away or somebody moves out of state. So as I was listening to that, it begged the question in my mind, how do you know when somebody moves out of the state or when somebody passes away? Obviously, when somebody passes away, there's a death certificate and so forth. But I guess the most important question in that is, how soon does your office find out? Are you connected in some way to other systems that tell you, or when someone moves out of state, how fast do you learn when somebody moves out of state? Because to me, it seems like this is really important for you to be able to project the decrease in the cases. I mean, one part of your equation is projecting increases, but the other one is projecting the decreases. So if you can enlighten me, because I'm new to this, I don't think I've ever heard the explanation.
Robert Thompson for the record. So to be clear what we're talking about, when we're talking about the projections that we're moving forward for the next 18 months, projections are done by the Office of Data Analytics, and they're looking at the holistic view of the economy, and they feed back to us what they have determined the number of Nevadans will be on need in the future. I determine how many staff I need to do the cases that we're receiving today. Data analytics determines what the future increase or decrease is going to be for the projections. When we talk about the current health crisis requires that we cannot shut down individuals that are on Medicaid unless there's those 3 reasons. That's really a short term through 2021. That really has minimal impact to the economic growth. Those are the small number of people that are meeting that criteria. I did verify after my early testimony that we do receive a monthly batch. It's from the Social Security Death Index when somebody passes away. So we receive that on the 5th of the month, and that goes into our computer system to notify our employees when a person passes away. When somebody moves out of state, we don't really know that they move out of state unless they tell us. But what normally happens is the person who is on assistance will apply for assistance in another state. So when they leave and go to another state, we have connections with the states. We spend a lot of time calling each other, and we have an actual directory. So when somebody is new to Las Vegas, we have to call California to make sure that they shut down their case in California. So when we call, that's California's trigger to shut them down. Well, we have the same trigger here. They can't approve food stamp benefits in that state until they talk to us. So when we get that phone call, we trigger the case.
That's really helpful. And actually, you did answer the question exactly what I was hoping you would say. But the question I have for you, the follow-up, if you don't mind, Madam Chair, is if somebody moves to another state but doesn't apply for unemployment in that state, or not unemployment, but benefits, how then would you ever know? And that's just a curiosity question. And
so Robert Thompson, for the record, we might not necessarily know until we send them that annual redetermination. That's why we're required by federal law to touch base at least once a year. In some cases, we do receive returned mail. And if we receive returned mail, we can see that somebody moved out of state and use that as a contact to reach out to the family and say, are you out of state now? And then shut it down. But there's not a formalized computer system between state to state to notify us at this time.
thank you very much. Appreciate it.
Thank you. And moving on to E232, I have Assemblywoman Carlton and Assemblywoman Teresa Benitez Thompson.
Thank you very much, Madam Chair. I know we are running behind a little bit, so I'll try to make these brief. On the 10 new positions for the new recovery through employment unit, I really appreciate this budget. Recovery-centered workplaces are going to be key for a lot of folks. We've had people who've had some issues over this past year, maintaining their sobriety and being able to stay where they needed to stay. And we know there's a lot of work to be done in the future. So I do appreciate what you're trying to do. A job does center people. Just going to treatment doesn't work. When they've got a place to go to every day and get work done, it's very valuable to those folks. So it's not that I don't support it. It's just, I'm not sure if this is the right funding mechanism. As I said earlier, there's other workforce dollars that can be used to, you have an excellent partnership in Dieter. Have you explored actually being able to fund these positions through other dollars so that we can free up these dollars to do other work?
So Robert Thompson, for the record, our division would not have any other funding source for this. Food stamp program does not have funding dollars for it, nor would Medicaid. The TANF dollars used for this would specifically target this resource for our customers who are receiving TANF, keeping in mind that while they're doing this outreach, and they're doing this outreach throughout our connections with Job Connect and our workforce development, it wouldn't just be used for only the TANF recipients. That has to be their primary purpose, to be able to use the TANF dollars. but we would be taking that information and feeding it back to our other programs and our community partners and sharing it. So this unit would be a holistic view for Nevada to really shore up and support this recovery-friendly workplace to assist people with the substance use disorder. I'm not aware of another funding source that we could pull to do this way.
Okay. And and there might be, there might not be. Let's keep our conversation open on that highest and best use of dollars. So where do you think these workforce representatives are going to actually be? And are there any incentives that the division planner plans to offer the employers to encourage the development of these recovery center workplaces?
So Robert Thompson, for the record, the reason that we chose the number 9 is because it wasn't necessarily due to the number of recipients that need help. It was due to the geographical locations in Nevada, that due to the number of employers in Clark County, we need a large group, a smaller group in Northern Nevada, and then at least one person who is dedicated to rural communities. So that's how the number was determined, and reaching out for how many employers that there are. And yes, there are incentive dollars available through the TANF workforce development dollars that we use, that we can offer incentives to the employers through on-the-job contracts. And that money is available at this time in our program. If this program became as successful as I'm hoping it would become, we might have to ask for an increase on authority to use some additional dollars.
And those would be TANF dollars then?
Correct. They are TANF dollars, the workforce development. In the TANF program, we have the monies that we use for transportation, bus passes, clothing.
Right, sure. And I understand, and I think that's good. I just want to make sure that I know within the Department of Workforce and Development, there's so many funding streams out there that deal with helping people get back to work. And I do believe there is an incentive program and some other programs, if we could use those incentive dollars to help here. My whole goal is just to make sure we use the right funding in the right place, because TANF dollars are very, very precious. So whenever we can try to pull down other dollars from another budget account, that frees up money to be able to help families in other ways. So I appreciate all the work that you guys are doing. I know some other folks are probably going to have questions on the office closures, but if I could, Madam Chair, very briefly, what I'm going to need is a map of what you're closing and the number of people you served in those, so that I can see the demographics of what's going on. And my biggest concern in this is having people work from home. That is a policy decision. I know we had to do it. We had to pull the trigger quick when the pandemic hit, but ongoing work from home, I think, needs to be a more global discussion. We shouldn't have to live where we work if we don't want to. And we know there's a lot of issues involved with that. Children, elderly parents, just needing to get out of your own house, having some place to go every day. So I would really like to have a much bigger discussion about having employees live where they work. The state will benefit. We will save money on rent, cable, electric, but the employee will be picking up those costs. So without a bump in pay, without some type of compensation, I just think there's a bigger conversation here on that. So thank you very much, Madam Chair, and I'll yield to the next person who has questions. Thank you.
Thank you so much. And members, I'll remind you that the Senate will be going on the floor at 11 and it's 10:14, and we still have 2 more budgets after we finish this one. So we'll need to speed it up just a little bit. I have Senator Dondero Loop and Assemblywoman Titus to discuss E685.
Thank you, Madam Chair, and I'll make my questions really quick. I concur with Chair Carlton about the map and where those closures will be and who they're impacting, because for example, when you mentioned the office on Flamingo and Durango, which is in my district, that's not in the Northwest. And that would be considered maybe the Southwest, and that would be the furthest south that that office would be. And we have a truckload of a city past that. So those people would have nowhere to come into. So I'd like to have that map, and I'll yield that question to seeing the map and determining where those closures are. Since we have such a large population in Las Vegas, I just feel like we shouldn't be closing some of those offices during this time. And then the other question would be, are these permanent closures, or are they just closures during this pandemic time?
So Robert Thompson for the record. I did misspeak, and I'm glad you said that. I am sorry, I did not mean to say Northwest. The Durango office is our most southwest office, and it's even southwest in my notes. So if I said Northwest, I apologize. It is the most southwest office. We have nothing further than Durango in the southwest, and the office closures would be permanent.
Okay, thank you very much. I'll look for that map and further discussion because due to time, I want to yield my time, but I do have some further questions. Thank you, Madam Chair.
Thank you. Assemblywoman Titus.
Thank you, Madam Chair. And also in the interest of time, I will try to keep this brief, but it's along the same concerns regarding closing of these offices. Number one, if they're permanent or not. And I'm not sure you answered that question. And then the next thing was these geographic locations. You mentioned that there's 19 offices that you have currently, and that 10 are in Las Vegas. And when you get us that map that Chair Carlton has asked for and the Senator has also emphasized, I would like to see, we've heard multiple times during these committee hearings, questions about parity and where these services are. And it's been very clear and spoken that 78% of our population lives in Clark County. And I understand all that. I want to see where the recipients are located. Are 78% of the recipients of these benefits located in Clark County also? Where's the parity? And hopefully on these maps that you would show us, you could give us the location of the population receiving these benefits. And as you mentioned already, 9 of these offices apparently are in communities, and that's their only office. And so when you look at kind of shrinking this down, there wouldn't be an option to close them, because how many, in Washoe County, you only have, you also only have one office. So everybody has to kind of go to that one office. And I guess that would be one question you might be able to answer. Does Washoe County have more than one office?
Steve, can you help me? I always get confused with the Washoe counties.
For the record, Steve Fisher, there are 2 offices. There's one in Sparks and there's one in Reno in Washoe County.
Okay, so Reno, so Washoe County has 2 really, really spread out over lots of miles, I guess. And then everybody else just has one. So people do have to travel throughout the rest of the mileage in the state. So when you send us those locations on geographic locations, perhaps you could also break it down, please, to the recipients and where they're located. That would be helpful also. Thank you very much, Madam Chair.
Thank you. So just want to make sure I have all the questions that I wanted to get on the record. Just, could you tell us, and if you've explained this, make it just really quick for my clarification, what impact would maintaining these positions that would remain vacant for FY 2022 have on the division's ability to provide timely and accurate services? And what would be the lag in the determination for the applicants for those services?
Robert Thompson for the record. Losing that many positions for 1 year will have a significant impact to our agency. It's math. The number of staff we have able to turn around the cases would be impacted. I could not sit here and tell you that it's going to slow us down by 1 day or 2% of the processing timeframes, because we're going to have to juggle, and we always triage, and we put the emergency cases first. Children without food come first, and the Medicaid cases, and we build that back in. Losing that number of positions is a significant number, and we wouldn't have them built into the budget if we didn't need them. So that it is an impact, but I could not sit here and quantify it for you exactly down to the percentage what that would be.
Okay, well, thank you. And I think that pretty much covers that budget. If there's anything else, we will have staff reach out to you, and we'll quickly move on to 3267.
I'm going to ask Joe Garcia to go through 3267. Joe?
Thank you, Steve. For the record, Joe Garcia, Acting Deputy Administrator for the Division of Welfare and Supportive Services. Good morning, and thank you, Madam Chair and committee members, for allowing me to present the Child Assistance and Development Budget. The Child Care Assistance and Development Program provides assistance to Nevada's low-income families in paying for their child care needs. These services assist people to become and remain employed, thereby reducing long-term dependency and the associated expenditures to public assistance programs. The Child Care Assistance and Development Program is administered by the Division of Welfare and Supportive Services, with service delivery accomplished by 2 separate contractors, one in Northern Nevada and one in Southern Nevada. The Child Care Assistance and Development Block Grant funds the following child care eligibility categories: new employees of Nevada, also known as the NEON program. Child care services are provided for this program to current TANF clients who are participating in various NEON components, such as orientation, education and vocational training, employment seeking, and work participation. At-risk category funds child care payments for non-TANF clients who are income eligible for TANF. Discretionary category funds child care and related payments for non-TANF eligible clients. Some of child care's accomplishments over the last biennium are: raise the reimbursement rates from 2004 market rate to 2015 market rate, partnered with Child Protective Services to expand eligibility criteria for families with reunification plans and voluntary plans, health and safety policies implemented in license exempt programs that serve subsidy, partnered with McKinney-Vento to expand policy for families in transition, and last but not least, developed a state disaster plan for child care providers. Next slide, please. M200 and 201 indicate that the child care caseload will remain relatively flat, with a slight increase over the biennium. Next slide, please. E226 adds 2 social services program specialists responsible for developing policy to expand and improve Nevada's early childhood services. Here's why we need them. This program initially focused on subsidy payments to providers for child care costs. However, the focus has expanded from affordability to looking at child care from a systems perspective and working with partners, families, and providers to impact the following: the quality of childcare, the childcare workforce, childcare capacity, meaning identifying deserts and target areas of need, emergent need and gaps in service, for example, types of childcare Nevada is lacking, plans and partnerships to address those needs, like non-standard hours for parents who work outside of 8 to 5, like those in the casino, retail, and restaurant industries, children with challenging behaviors or special needs, trauma-informed care, training and slots for infants and toddlers. Also working with various agencies, programs, and stakeholders to improve and align service delivery, such as childcare licensing, Nevada registry trainings for childcare staff, early intervention, and working together with partners to blend funds to wrap services around families and providers. The current size of our team does not meet the staffing level needed to get all of this accomplished. We mapped out current team duties and compared them with our 5-year strategic plan. identified the gaps, and determined we needed 2 additional staff to assist in successfully achieving goals of the strategic plan, which are expanding childcare services to meet current and future needs of families in Nevada. Now on to E551, funding a new childcare case management system. You're looking at an estimate, and we are currently developing the RFP. All costs are fully funded by federal grant revenues. We estimate $16.1 million over 5 years and $1.5 million annually for licensing and maintenance thereafter. The estimate was determined by reaching out to the Office of Child Care and Development for an average of other states' projects, and we also worked with software vendors. The State IT Strategic Planning Committee, ITSPC, ranked the child care replacement system number 2 in importance out of 12 statewide IT investments. The current system, known as Nevada Child Care System, NCCS, was implemented approximately 15 years ago and has had many patches over the years, now requiring workarounds by staff and partners to accurately complete work. Additionally, report data often requires rework. We are the centerpiece that connects the Department of Education, licensing, the Children's Cabinet, the Urban League, and many other early childhood programs in one strong partnership. We are making a difference for families in Nevada, thus tracking the early childhood program activities to ensure we are successful and making necessary, timely changes to program when we need to adapt for success is paramount. Madam Chair, this concludes the 3267 budget presentation, and I give the floor back to you for questions.
Thank you. I know we have a few questions. Assemblyman Watts?
Madam Chair, building on some of my questions on a previous budget, I just want to talk a little about caseload. And could you clarify for us, does the executive budget cover all of the projected caseload, or would there be wait lists over the biennium for applicants for these services?
Joe Garcia, for the record, I'm going to defer that question to our our child care chief, Christelle Askew.
So this is Christelle Askew for the record. So our caseload currently is at a maxed out number. I'm sorry, could you repeat the question? I apologize.
Sure, of course. I just wanted to know if the funding that's recommended in this budget is sufficient to cover all applicants, or if the agency anticipates having a wait list over the next biennium.
So we do anticipate having a wait list. We do have a restricted number of children that we can serve with the funding that we have that goes toward the caseload. And currently we will continue to have that wait list in place.
Great, thank you for that clarification. Also, building on the question I asked on the previous budget item, could you speak to the impacts of the COVID-19 pandemic on this program? What has the impact been, and what changes has the agency made in response to that, and how do you see that continuing on during the next biennium?
This is Christelle Askew for the record. So one of the things that that happened with our caseload is that we already had quite a large caseload. And when COVID came into play, we put some policy in place to try to sustain childcare businesses throughout the pandemic. So one of the things that we did was we paid based on enrollment rather than attendance, and we waived redeterminations. We didn't look at absences at all, and of children going to childcare. And so we really sustained that high caseload throughout the pandemic. And then we also have federal regulations like 12-month eligibility. So even though parents have been keeping their children at home, we still have a rather large caseload just because of all those factors, the COVID policies that we put in place and that 12-month eligibility requirement.
Thank you. And then just the last portion of that, just to get a little bit more clarity, how do you see some of those measures continuing or phasing down over the biennium in this budget proposal?
This is Christelle asking for the record. It is our intention to actually reinstate some of those policies. We want to reinstate the payment based on enrollment. We want to waive looking at attendance. And even if a provider has to close until the vaccine is rolled out and everybody's back to being stable again, we want to make sure that childcare survives this pandemic and comes out the other side. We want to make sure the industry survives. So we will be putting those policies back into place. And I can't answer any question about how long those policies will be in place, but it is our intention to reinstate them.
That answers my question. Thank you very much. And thank you, Madam Chair.
Thank you. Senator Ratty?
Sorry, I was having a little bit of a hard time getting off to mute there. So I want to talk about the case management modernization system. And just very briefly, how's that going to help improve the agency operations?
So, yeah, I just wanted to say something briefly. This is Joe Garcia, for the record. So I'm going to let Christelle ask you respond to that question. But first, I wanted to say that the system, the current system, as I've learned, you know, I'm the acting deputy administrator, so I'm trying to wrap my head around this too, is pretty antiquated. And in working with Christelle, we have, or she has identified, and I have identified some major issues with the current system in the information that we gather from that. And that's information that's very important that we have to use in the child care program. And I just wanted to put it on the record that I firmly believe that it is extremely important that we get this new system in place, not only to benefit the customers that we serve and the children that are in childcare, but also the agency. Because without the correct information and without accurate data, we can't appropriately move forward and accomplish all the goals that Christelle and her team have developed, which are phenomenal. So Christelle, I will hand it over to you now.
Thank you, Bill. This is Christelle asking for the record, and I do agree that the system is antiquated, that it's a broken system. We can't get accurate data. There's so many workarounds that it really makes the data even worse. And a lot of extra time is spent within the system trying to get eligibility and all those things. But I heard somebody say earlier, they were talking about preventing benefits in perpetuity, success rates. Is this working? And that's really what we want to know. We want to have a system that really tracks all that data so that we know what's going on with our families, so we know that they are successful and we know what's happening. We want that case management piece. We want to really be able to know who we're serving. And if they're coming off the program, is it because their income is now in excess and they're able to move on and they've gone somewhere and they've moved up that ladder in employment? And so when I heard those words, that really struck me, because that is the purpose of a huge portion of why we want to have this system is data-driven program management and building out our programs and our policies to support the need and know what impact we're having on the community.
Great, thank you. And just very briefly, given the time, how do the federal partners fold into this modernization project? Do you need approval from them? What's that relationship look like?
Oh, this is Christelle asking for the record. They're very excited for us. We actually took part in a program called the Momentum Project, in which we had a lot of federal TA and guidance, walking through the different things that we could do within the system. They worked with us to look at other states, you know, what kind of systems other states had. We also had some federal partners come out and sit down with us and look at the current system we had a couple of years ago. We found a lot of issues within the system with the data that we're putting together, even for our federal reports. So they're very excited for us to be able to have a system that tracks all the things that they want to see, and for us to be able to do all of those other important pieces, aside from just the subsidy, but really looking at the family holistically. And making sure that we're helping them move forward and being able to track the outcome.
Assemblywoman Tolles?
Yes, thank you, Madam Chair. And I wanted to revisit just really quickly some of the questions from my colleague Assemblyman Watts in regards to the caseload changes, because I thought I understood. I'm looking at the numbers, and in 2020 we had 10,413. Fiscal year 2021 we dropped down by 7.18% to 9,665. Then in fiscal year 22 we jumped back up to 10,470, and then 2023 up again to 10,587. And so it does appear that we have made an adjustment for fiscal year 2021, down by 7%. Was that because of COVID? And if you could just help me understand better, because I heard you say we're not making projections on attendance, we're making it on enrollment. So was that based on drop of enrollment? And was that based on COVID?
This is Crystal Askew for the record. It is my understanding, with the information that I have, that some families are not redetermining their case. So even though we have that 12-month eligibility that really sustains our caseload, when it comes to that end of that 12 months, some parents that have been keeping their kids at home aren't actually re-enrolling in the program.
Okay, but we think that either they will starting in 22 and 23, or that population growth will restore those numbers back to 2020 levels.
This is Crystal Askew for the record. I would speculate that as the vaccine rolls out and people are going back to work, that they will re-enroll into childcare.
Got it. That makes sense. Thank you so much for that clarification.
Thank you. And could you tell us what specific additional requirements, responsibilities, or activities have been added to the program by the federal government and how these duties currently are being performed?
This is Crystal Askew for the record. So one of the biggest things I think that happened, we had a reauthorization of the grant. It's been a few years since that happened, but that really brought to light a lot of health and safety pieces that we were implementing. But I think that within our state, we really realized that there were a lot of gaps in services. We've had needs assessments. We've been looking, and this is something that I have worked a lot with the federal partners on different conferences that I went to, and really looking at best practice and how to move your state forward in a systematic level in childcare. So really taking that focus from subsidy, which is also extremely important in working with poverty, but growing it out to look at childcare as a whole and how to have better quality within it, and looking at the capacity of childcare, because one of the things that we've learned is that really when you talk to parents and providers, families, everyone throughout the state agrees that capacity is one of the biggest issues that we have. Last time we looked, when we look at poverty, we're only serving about 4% with subsidy, but also when we look at seats in general, we have about 10% to meet the need for childcare seats in general across the state. And so really we decided within our state that we wanted to take an active approach to trying to address all of that need to make childcare better in Nevada overall.
Okay, then just the final questions. How would the duties of these recommended new positions be distinguished from those of the positions approved during the 2019-21 biennium? And how would the recommended new positions, if approved, increase the access and capacity of quality childcare in our state?
This is Crystal Askew for the record. So because our program has grown so much, not only do we have double the amount of children that we're serving, but we also have more subawards, more contracts, more partnerships. So when we brought on the new positions, we have somebody to help us with RFP development. We have someone to help us develop the subawards and the contracts and work with fiscal on those piece of things. And then on the program side, it's really about doing that outreach, making those partnerships. And we had a strategic plan consultant that we contracted with, and when they came to us, they did key informant interviews across the state with a ton of early childhood stakeholders and people that work in early childhood. And one of the things that bubbled up was that they were really looking for somebody to show some leadership in Nevada. And I feel like we really are the ones that make most sense to do that because we administer the Child Care and Development Block Grant, and we already work with all of these different early childhood folks in Nevada. So we're really kind of the centerpiece that brings everyone together. So we just want to have positions in place for specific folks within the program to be able to strengthen all of those partnerships, make sure that we're not working in silos, everybody's got their nose to the grindstone here and over here, but bring everybody together so that we provide a service delivery that helps families across the board and makes things easier for them, and just to really try to make a more robust system for providers and for families.
Thank you. Okay, members, that will conclude the discussion on that budget. And it brings us up to our last budget for the day. It's 4862.
Mr. Thompson?
Good morning. Again, Robert Thompson, Deputy, for the record, Robert Thompson, Deputy Administrator. I will try to give a fast overview. I know that you are running out of time. The overview of the Energy Assistance Program is that the Energy Assistance Program, it provides a supplement to assist qualifying low-income Nevadans with the cost of their home energy. Nevada's EAP program has two funding sources: the Low-Income Home Energy Assistance Program, which is a federal block grant, and the state revenue generated from Nevada's Universal Energy Charge, UEC. And you may have seen that on the back of your power bill. I checked mine for the last few months, and it runs 30 cents to 60 cents on my power bill, and that money is brought in to fund the Energy Assistance Program. The Energy Assistance Program has an income limit of 150% of federal poverty. 150% of federal poverty for a household of three is right at $2,715 per month. So that's the number we'd be looking at for eligibility for this program. Next slide, please. In the Energy Assistance Program, the funding sources are not static. DWSS receives, like I said, from the federal block grant and from the UEC charges within Nevada. But because the funds are not static, we work with the projections of the dollar amounts that we believe are going to be coming in to determine the amount of dollars that we'll be able to assist Nevadans with. We project conservatively in these caseloads, and then often if we receive additional funds, we retroactively increase the previously approved households. So M200 and M201 do show small increases in caseload, and those caseloads are increases are determined by our data analytics team. Next slide, please. Slide 26. The main enhancement unit here to talk about is E810, and we are requesting to reclassify these positions to utilize family services supervisors to formally supervise this program, and reclassify two administrative assistants to the level of family services specialist to be assigned as formal lead workers and trainers of this team. This restructure would align the Energy Assistance Unit career path to be the same as we use in other areas of the agency. The history of the Energy Assistance Program was it used to be all temporary staff. Then we brought them in as state staff, but they do not currently have the same career pathing as other areas of our agency. So when we're using program officers to supervise, it's breaking the career path. And individuals in this program that want to promote end up leaving the Energy Assistance Program to go over to the food stamp program, Medicaid, TANF, the other side of our house, and we lose that historical foundation of the program. So we're hoping to be able to reset this pathing structure to give this team the ability to stay within their specialized units and carry the program forward. And that is all I have on 4862.
Thank you so much. I know we have a few questions. We'll start with Assemblywoman Carlton.
Thank you, Madam Chair, very much. So very, very good program. So What does the agency determine in whether you're going to issue a supplemental payment? I know a supplemental payment was done during the pandemic time period. And do we expect another supplemental payment in 21 to 23?
Robert Thompson, for the record, we received additional funding through the CARES Act that allowed us to do the retroactive payments during the pandemic. We project the caseload as how we believe it will be that wouldn't allow for the supplement. We project it to give out the amount of money that we believe we'll be getting. But historically, we always end up receiving a little bit more than we planned on that allows us to do the retroactive payments.
Okay, and that was CARES Act money. Did the agency have any difficulty in processing that?
Robert Thompson, for the record, I would not say that there was difficulty in it. That is always a manual process to do the supplements. So it's not necessarily a fast process, but it's not difficult.
Okay, all right.
Part of our, it's part of our routine.
Okay, all right. Just, you never know what's going to happen in the future. So the funding levels that are recommended in the budget currently for the Energy Assistance Program, will that allow all the eligible households currently to be served?
Robert Thompson, for the record, yes.
Okay. Does it account for growth?
Robert Thompson, for the record, yes, it does. It is accounting for growth.
Approximately how much growth?
Robert Thompson, for the record, approximately a 14% increase. I'm sorry, a 12% increase in 21 and fiscal year 23 takes it to a 14% increase.
Okay, thank you. I think it would be good for us to compare those percentages of increases with the increases with Medicaid, SNAP, and other things. I think that's all going to be the same population. They're going to be accessing services across the spectrum. So I just want to make sure that our growth models fit all the way across. So thank you very much, Mr. Thompson. I appreciate that. Thank you, Madam Chair. Trying to go quickly.
Thank you. And wrapping this up will be Assemblyman Watts.
Madam Chair, quick question on item E805. You mentioned the difficulties in creating career paths, but I was wondering if you could just discuss a little bit more any differences in the duties and responsibilities between the administrative assistant position and the family services specialist position.
Robert Thompson, for the record, currently the administrative positions are not acting as the lead workers. Family services specialist in this team would be considered subject matter experts. They would be the ones that would be doing the training of the team and rolling that out. The administrative assistant positions are being given up to support that and are being able to be given up through efficiencies created in other areas of our program. So the duties are 100% different when you talk about the administrative assistants, the family services specialist. Right now, the program officers are carrying the entire load, and as it's worked out through the years, they are probably not working within class, which is requiring the social, or would not be working within class. We don't allow our people to work out of class, but requiring the social services manager to do more of the supervisor duties than she should be.
Again, can you just speak a little bit more on how reclassifying the two program officer positions will improve the day-to-day operations for the EAP?
Robert Thompson, for the record, the program officers are acting as supervisors when their job specs are not fully as supervisors. So they are, we don't necessarily have the right skill set in there. And then what is happening is because of their grades, there's a high turnover. The program officers are leaving when family services supervisors, who are grade 34s, normally are stable long-term. So we've got a rotating door in and out So we're losing our historical knowledge every time we have to retrain a supervisor. So that stability and consistency for the team would be the ultimate goal and the benefit of this enhancement unit.
Thank you. So it sounds like some of those efficiencies are also in not having to retrain as people are moving in and out. Great. Those are the questions I had, Madam Chair.
Thank you. And I just have a final question. So the reclassification of these two program officers positions improve the day-to-day administration of the Energy Assistance Program. Is that true? And how will they increase that?
Robert Thompson, for the record, they would be increasing the day-to-day efficiencies of this program, because hopefully we would remove that revolving door that we keep losing each time. We don't have a stability in that program. So when we create subject matter experts and we create supervisors and we create lead workers who understand their program, they can pass that knowledge down to train their staff and keep the program solid. I don't know if I'm explaining that well enough, but it feels right now that the area is fragmented and continues to be fragmented. And by aligning their career pathing with the rest of our agency, it would stop those people that want to promote. They want to be supervisors, and it feels like they're getting a taste of supervision, then they jump ship.
Thank you. And thank all of you for joining us here. That is the last question. I don't see any other questions from our members. So I appreciate you joining us today for this very important discussion, and I wish you a good day. Members, the last item on our agenda today is public comment, and I would ask our BPS staff to open the lines for public comment.
Hello, Chair. This is Michael from Broadcast. I have 2 callers on the line right now. Would you like me to take the first one?
Yes, please. Thank you.
Caller with the last 3 digits, 762. Please slowly state and spell your name for the record. You will have 2 minutes and may begin. Caller with the last 3 digits, 240. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning. My name is Amber Howell, AMBERHOWELL. I am the director of the Washoe County Human Services Agency. Good morning, Madam Chair and members of the committee. Thank you so much for the opportunity to speak today. I'm speaking on behalf of Washoe and Clark, as Clark had another hearing they had to get to. Just want to direct the committee's attention that we did send a letter expressing our strong interest in solidifying an ongoing sustainability plan for the TANF allocation to counties, especially with the significant cut that was mentioned today in the child welfare funding that DCFS has proposed. In 2011, when the block grant was established, the child welfare funding, TANF was intact and funded to the counties annually, and in later years, the TANF was cut, but the block grant was not adjusted. Mr. Fisher had indicated in his testimony that the TANF money was restored to the counties, but as was discussed today, you can see it's not slated in the budget ongoing for the next couple of years. We did receive one-shot funds 2 years in a row, and we greatly appreciate Mr. Whitley and Mr. Fisher's support to those efforts, but it hasn't been restored ongoing. We have a vested interest in meeting the fiscal benchmarks with welfare that they need to meet, and we have dedicated 2 full-time staff to help ensure that they meet those benchmarks with the federal government. and assist any way we can with that initiative. We've done quite a bit of research on TANF reserves around the country, and our findings are that according to the Center on Budget and Policy and Priorities, the average TANF reserve for states is about 36%. In Nevada in fiscal year 20, there was 37 million, which equates to 84% reserve, which is double the national average. In fiscal year 21, there is 43 million, which equates to 99% reserve, which is nearly triple the national average. These TANF funds support core services for our population. And now more than ever, with Washoe County and Clark serving the majority of the TANF families, we are in dire need of these safety services to assist families stay together and keep children safe, sheltered, and with their families. We know the difficult task the committee faces, and we are ready to assist in prevention efforts with the Division of Welfare that keeps costs down and families together. We would really appreciate any ongoing dialogue and consideration to restore this critical revenue that was cut within the last decade. With our populations rising, increase in financial stress on families, serving populations that were never served before due to the pandemic, an increase in mental health challenges and overall impact that our families are facing for the first time ever, we believe that these reserves should be put to work to help Nevada families and children and not be held in large reserves. I appreciate the opportunity to speak today, and I look forward to ongoing discussions to see what can be done to allocate TANF funds to the county child welfare agencies. Thank you so much for your time.
Thank you so much for your comments, and thank you for the letter you submitted. Next caller.
Hello, caller with the last 3 digits, 762. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hi, my name is Robert Burns, RobertBurns. I'm the President and Board of Director of the Early Intervention Community Providers Association and a Managing Director of Therapy Management Group. EICPA is the trade association for early intervention service providers here in Nevada, and the members are Therapy Management Group, Capabilities Health and Human Services, Positively Kids Foundation, The Continuum, and Advanced Pediatric Therapies. These community providers contract with Aging and Disability Services, Nevada's early intervention program, to provide services to approximately half of the children and families in need of early intervention services. The governor's executive budget for the Early Intervention Services Budget, BA 3208, includes 3 important items. Caseloads, kids served, is projected to increase from approximately 3,500 in fiscal year 20 to 3,930 in fiscal year 23. This is an increase of 430 children to be served. The state program is holding 29 positions vacant and will continue to do so through fiscal year 22, making it exceedingly difficult for the remaining state staff to serve needy children and families. Community providers' monthly payment from the state for services provided to children is being cut from $565 per month to $500 per month. This is approximately a 12% reduction and will create extreme challenges for community providers, possibly even some to end their contracts with the state. This cut and reduction will reduce payments to community providers by $1.9 million per year. So why am I here testifying about the TANF temporary assistance to needy families budget? We understand the state is experiencing difficult times financially due to COVID pandemic, and we were asked by the staff who manage the state early intervention services program to identify funding solutions. We believe use of TANF reserve funding is a possible solution to the deep cuts being made to early intervention services, BA 3208. During the Division of Welfare and Supportive Services pre-session budget presentation to the Legislative Commission Budget Subcommittee on January 21, 2021, information was provided that there will be a $43.4 million unobligated reserve at the end of fiscal year 21 and a $31.8 million unobligated reserve at the end of fiscal year 23. This is a large reserve amount, nearly 100% reserve of the $44 million TANF block grant awarded to Nevada at the end of fiscal year 21 and a 72% reserve at the end of fiscal year 23. According to the Center of Budget and Policy Research, most recent report on how states use the TANF funds, the average amount states have retained in reserve status is 36%. The Nevada TANF reserves are more than double the national average. In fiscal year 21, nearly triple the average. These reserves should be put to work to help Nevada's children and families, not held in large reserve balances. TANF funds are being budgeted in the governor's executive budget to be used to support the Autism Treatment Assistance Program, transfer of approximately $2.9 million per year to BA 3209, and to support the Nurse Family Partnership Program operated by the Southern Nevada Health District at a cost of about $800,000 per year. We do not understand why TANF funding was not considered to also be used to support the early intervention services community providers rather than making deep cuts to the program and possibly resulting in significant waiting lists for services or providers going out of business. The EIPCA urges the Senate and Assembly subcommittees on human services to explore the use of TANF's unobligated reserves to support the early intervention services program, just as has been done for the autism program and the nursing partnership program. Preliminary discussion with state staff on the use of TANF funds for EI program services resulted in the EICPA being told it was not allowed under TANF rules because the EI program was a medical model. This is no more
Mr.
the
Burns?
case for the EI program. Yes.
Mr. Burns, I need to
Yes.
stop you. Thank you so much. I know you submitted a letter and all of our members on the committee have that. I thank you for the letter and I thank you so much for your comments. BPS, do we have any other callers in the queue?
Hello, Chair. This is Michael from Broadcast. The public comment line is open and working. However, we have no more callers at this time.
Thank you so much. And members, that will conclude today's meeting. I'm sorry that we ran a little long, especially for the Senate side. I apologize. I know you need to go to the floor. Thank you to all our presenters, the committee members, our broadcast staff, and the members of the public who patiently stayed with us throughout this virtual meeting today. And with that, this meeting is adjourned. Have a very productive day.